It is my honor and privilege to welcome you all to BW Healthcare World's World Diabetes Day Conclave 2022. This is Shivam Tyagi, and I will be taking you through the proceedings of this insightful virtual conclave. Today, we will listen to India's top endocrinologist, neurologist, gynecologist, ophthalmologist, and other industry leaders who carry the torch of expertise in India's healthcare sector landscape. Today, you will witness the best diabetic health insights, advice, and solutions coming from experienced and specialized doctors and diabetes health experts on how to keep our blood sugars levels intact. Diabetes is a multifaceted disease, and it opens the Pandora's box for various other fatal diseases. We are already known as the diabetes capital of the world, and with bad eating habits and lifestyle changes, it is predicted to rise even more in the coming years. Today, we'll try and dissect each and every part of diabetes and every other comorbidity that comes bundled up with it. Now, to start off the proceedings of the World Diabetes Day, we have the introductory address to World Diabetes Day, and we have with us Mr. Harbinder Narula, CEO, BW Healthcare World and BW Wellbeing World.
On the World Diabetes Day, let me share with you the context of why I feel that diabetes is something that needs immediate attention, far beyond what we have already been giving to this condition. We have 77 million people in our country who are affected with diabetes. We have 700,000 people Indians who have died of diabetes. According to ICMR, there's been a 150% increase in the cases in India. And this is growing. The theme on this World Diabetes Day is creating awareness and education. But an important aspect to understand is also to educate people of how to manage this condition. Life does not end or come to a halt if you're diabetic. We need to understand one thing, and that is that if managed well, a diabetic can lead a quality and long life. When I spoke with well-known endocrinologists and diabetologists for this day, I observed that they have been seeing patients who have lived well with diabetes for the last 30 to 40 years, and in many cases more than that. And in fact, probably living a better life than those who are not diabetic, only because they brought consciousness in the way they were living. What was very beautiful when I spoke to these experts, these specialists, is that the life changes that these diabetics were expected to make are the same life changes that the non-diabetics are expected to make to be able to prevent diabetes in their own life. But diabetes is a big burden on our population and thus our nation. With such a large percentage of young population, it is important, it is imperative for us to give the due attention that it needs. It is important that we share the knowledge of experts and educate people of how to prevent being diabetic. And if you are diabetic, how to manage the condition so that you do not become a burden, not just for the state, but also for your own life and the ones who love you. I'm so grateful to all the speakers who have taken out time to share their knowledge and their guidance with all of us today. I mean, we have Dr. Ambrish Mittal, Dr. Ashok Damir, Dr. Praveen Gupta, Dr. C.M. Birla, Dr. Arun Singhvi, Dr. Garima Sani, Dr. Bhakti Samant, and Namita Piparaya to share with you how you can understand and manage diabetes, how to prevent getting to a condition where you do not end up having a diabetic foot. What is it that you need to do to prevent the eye problems? What is the kind of nutrition should you be taking care of? What is it that the woman who is diabetic and becomes pregnant needs to do? And if you need to exercise, what are the benefits of yoga? In fact, Namita is going to demonstrate the 5 asanas that you could do as a part of your daily regime, which are not very difficult. So I'm sure whoever listens and watches this program today will have a lot to benefit from to be able to lead a life as a better one. So without wasting too much of time, I once again welcome all of you on a World Diabetic Day to the BW Healthcare program that aims to help you lead a better quality and long life. Thank you so much for joining us for this program. I hope you will enjoy every minute of the valuable conversation with these experts from the Indian healthcare industry.
Diabetes is a painful disease to live with, which involves popping pills, eating right, and ensuring daily exercise. And you guessed it right, it's not as simple as it sounds. So, to tell us on how to live a quality life with diabetes, we have Dr. Ambrish Mittal, Head of Endocrinology and Diabetes, Max Healthcare, Pan Max, Saket, New Delhi.
On the World Diabetes Day, it is indeed my pleasure to have with us Dr. Ambrish Mittal, who is the chairman of endocrinology and diabetes at the Max Hospitals Pan India. Prior to Max, he has been as the chairperson of endocrinology and diabetes at Medanta Hospital, and he is the honorary president of the All India Institute of Medical Sciences, Gorakhpur. Dr. Ambrish Mittal was awarded the Padma Bhushan Award by the President of India in 2015. He enjoys traveling, he enjoys photography, and I've been following him on social media, so I know the quality of pictures that he takes and the passion with which he has made it his hobby. Welcome to BW Healthcare World on this special day, Dr. Ambrish Mittal. So welcome to BW Healthcare, Dr. Mittal. Let me begin with a very basic question. If you can explain what exactly is diabetes for the benefit of a layperson, what exactly happens inside the body that causes diabetes?
So, essentially diabetes means elevated blood glucose. So elevated level of sugar in the blood is the same thing as diabetes, basically. So this happens in broadly speaking, there can be multiple reasons why it happens. It's not a single defect disease. So it's a combination of various defects that leads to a condition where you get high blood glucose, a fasting over 126, and a post glucose over 200 milligrams, and then you call a person diabetic. So at a pathophysiologic basis, at a sort of within the body kind of thing that you're asking, there are two things that happen. Number one, that there is insulin in the body that keeps our blood glucose at level. So if there is resistance to the action of insulin, so insulin, which is secreted from the beta cells of the pancreas, so if it's going to our cells, it drives the glucose to move within the cell so that the cell can utilize glucose for energy. So if there is action, resistance to insulin action at the cellular level, then the blood glucose goes up, right? And that is what is called insulin resistance. And that happens, of course, with increased amount of fat in the body, low skeletal muscle mass. It happens at the liver level. It happens because of inactivity, and there are multiple reasons. So insulin resistance is one of the key things. Insulin resistance doesn't just cause diabetes. It's also involved in heart disease, high blood pressure, and so many other things. The other component of the pathophysiology, as we call it, of diabetes, is deficiency of insulin. So on the one hand, insulin is not able to act. On the other hand, there is deficiency of insulin. So the pancreatic secretion of insulin, the beta cell, that just gets tired, and that is how diabetes happens. The pancreatic beta cell is programmed to die over a period of time, or at least reduce its function. So therefore, because of this programming, the insulin secretion keeps going down. So then you have a combination of insulin resistance and insulin deficiency. Initially, what happens when there is insulin resistance, the body secretes more insulin, more higher amounts. But what happens is that is trying to overcome the insulin resistance. When there's resistance, you make more and more, send more forces, more troops to break the wall. But at some point, your forces get exhausted. And they stop, they just can't do it anymore. So then the secretion dies down. So insulin resistance and insulin deficiency then both happen together. When both happen together, we get classic type 2 diabetes. I'm not talking of type 1 today. Type 1 is a totally different condition. All the statements I will make, unless specified, will refer to type 2 diabetes. Type 1 diabetes, there's a pure insulin secretion defect that happens because of a pancreatic damage, which is because of virus or autoimmunity or whatever. That is type 1 diabetes, right? So this is what's happening within our body in type 2 diabetes.
Right. So we, as a nation, are a diabetic capital of the world. We are considered as a diabetic capital of the world. And a lot of people get scared of the situation as we hear it leads to major problems like cardiology, eyes, and diabetic foot, etc. Can people with diabetes live as much a normal life as non-diabetics? Of course, with precautions, but can they live the same quality of life?
I think that's a great question, and it's a very important myth to bust, actually. People with diabetes who take care of themselves, follow lifestyle, monitor regularly, take their medication as advised, follow medical advice, see the doctor or a nurse when required. Their quality of life is as good as people without diabetes. At times, it can even be better because they are monitored more closely and they're looking at parameters that can affect their health. And so they catch on early symptoms or early abnormalities, which a normal person would not have gone for. So I think it is very important for us to understand, and it's not like just I'm saying this to make people feel good. I mean, you come to any endocrinologist OPD, you'll find patients who have 40 years diabetes, 50 years diabetes, and they're walking in with their files in their hand. So what I'm saying is that yes, it is very much possible with diabetes to have a normal and healthy life. But yes, certain amount of restriction or discipline rather than restriction will have to be followed, which is actually good for everybody, more or less. The lifestyle we advise for people with diabetes is the same thing we advise people without diabetes. So actually it's good for everybody to follow that lifestyle and the diet also. So I think that this myth that once you have diabetes, it's a life sentence, you're condemned for life, a feeling of restriction and a feeling of getting trapped, that comes into our patients, that is not correct. That should be dispelled. You have to take it in your stride, take it as a positive thing in the sense that it is there, it has to be dealt with. Sometimes it can even be reversed. Otherwise, you have to live with the lifestyle and medication. Just do that and you'll have no problem.
I think you brought up a very valid point that the lifestyle modifications that is required is the same as what somebody who does not have diabetes should also be following to prevent diabetes.
Correct.
So
correct. Absolutely.
That's a very beautiful point that you brought up. Dr. Medhul, diabetes is considered to be a lifestyle disease.
Yes.
What in lifestyle actually causes it? Does it mean that any person leading that lifestyle will get diabetes, or is it certain body types that are more prone to get diabetes over others?
So obviously, it's not only lifestyle. It's genes plus lifestyle. So, those who have a family history are always more prone. And because they're more prone, they may get diabetes with a moderately good lifestyle also. Whereas others who don't have a family history can be very indulgent and still may avoid it for many years. So it's said that genes, they load the gun, and the environment or a lifestyle, it pulls the trigger. So it's often a combination of both. So yes, certainly those who have genetic predisposition will have a greater risk of getting diabetes. And therefore, those who have a family history of diabetes should be doubly careful in their approach to preventing the disease.
Got it. Now, since it's a lifestyle thing, what lifestyle management must be taken care of for people to lead a quality of life even when they have diabetes?
So I think one of the fundamental things we need to understand that people who are overweight or obese or have excess body fat are the ones who are most likely to get diabetes. The risk increases exponentially with severe obesity. Okay, so I think it's pretty important for people to understand this link. I'm surprised that even now people don't understand this link, and they're not very sure of the link, and they say, oh, my glucose is normal, I'm not having sweets. But I said the only way you can reverse it or reduce your medication is to lose weight. So the lifestyle we are talking about means things that will ensure that we maintain appropriate body weight for our height, which means maintaining a BMI of 23 or less. So, which means that, again, the same boring stuff which you've heard many times, you have to eat healthy, which means you avoid refined sugar, avoid other simple carbohydrates, white bread, maida-based things, increase your green vegetables and fiber, and increase protein in the diet. By whatever means, try and maintain your body weight. And overall body weight is important, but what is particularly important is that abdominal fat, which is particularly common in Indians. And that abdominal fat, even small amounts of abdominal fat, can increase our risk of developing diabetes and heart disease. So this is the diet thing, but you also have to match it with exercise. Exercise is very important. It's debated as to how much is required, but a minimum of 180 minutes per week is important. But as we say nowadays, you should mix it up, all kinds of exercise. But exercise, like diet, depends a lot on the individual and what the person enjoys the most. I think that's what they should do. So diet and exercise, we do think that easier said than done. Fighting stress is very important, and combating stress by whatever you can. You may go for a walk in nature, you may take pictures, you may listen to music, you may do what you like, but stress busting is also a very important component. Sleeping on time and sleeping properly is very important. People who commute from Gurgaon to Noida and this and that, I mean, I don't see how a life can actually be ever disciplined, because it's just too harsh. They are young, so therefore they can handle it, but at some point it catches up. So I think it's these are the basics. With these basics, nothing, it's all that your grandmother told you, nothing different than that. Go to sleep on time, wake up on time, do some morning exercise, eat healthy, have early dinners or very light dinners, those kind of things. Right. And keep your weight in check. Understand the importance of weight in this central fat. And you certainly can reduce the risk of diabetes, or if you have diabetes, you can reduce the severity of the condition.
You mentioned stress. Is it a reality that if you are stressed and you check your sugar levels will be higher?
Yes, when you have acute stress, the sugar level will be high. Because there are certain hormones released in the blood, and you all have heard of adrenaline rush. Adrenaline. So when you have an adrenaline rush, you would get a high blood glucose at that point.
Right.
So I think that is yes, that is there. It's
Got it.
usually temporary though, usually temporary.
Okay. Okay.
But when you have slightly more chronic stress, you get higher cortisol.
Okay.
Not even chronic, but little more prolonged stress. The first one is adrenaline and then cortisol. And cortisol also raises blood sugar. So both adrenaline and cortisol will raise the blood sugar.
So I'm just trying to correlate because you mentioned that, apart from exercise, stress busting is also equally important. So I would believe that meditating or calming yourself down is also an
Yes, yes.
extremely important aspect of maintaining.
Absolutely, 100%.
Right. Dr. Mithil, a lot of kids are developing type 2 diabetes at an early age. Usually it was always taken that, it was as in when you grow in your 40s, you will get diabetes. But I've seen a lot of people getting below the age of 18 as well. What could be the reason for this? Is there a message that you would have for the parents on managing the lifestyle or the conditions for kids so that they don't end up having diabetes? Because the reason I'm asking this question is because after pandemic, a lot of children have taken up to gaming online, etc. They don't go out. I don't see children doing physical activities.
So you're absolutely right. And if you ask me as an endocrinologist, as a physician, as someone involved in public health, my biggest concern is the rising type 2 diabetes in children. I think that's pretty sad the way it's happening. There is no doubt that the age at onset of diabetes has come down. And the inflection point of increase in diabetes, which was well into the 30s or 40s, is now at 20 or even less sometimes. So the prevalence of type 2 diabetes, which should not be happening in children at all, as you very rightly pointed out, it is hitting children. There's no question about that. And what you brought to notice was the most important fact, and that is just poor lifestyle, bad management, bad eating habits, bad sleeping habits. Children play with their mobiles all night and then go to school next morning. They order food from outside all the time, which is very difficult to find healthy food from outside. Okay, so all those things are there simply because of that. Children are, during the pandemic, some children I saw, 4 or 5-year-old, not a diabetic today, but he wouldn't give up the phone. He just wouldn't give up the phone. He had come with his parents. He wouldn't give up the phone. He wouldn't let them take it away. So what I'm saying is the way things are happening, first it was indoor confinement because of affluence and greater convenience. Then it became television, then computers, and now the mobile phone. So all these are the prices, this is development, of course. This is important development, but the price we are paying for that is that our children are getting like zombies, some of them becoming zombies. And even if they're not extreme zombies, their tendency to put on weight is much greater. So when we were children, and as many years ago, you would find an odd kid or two who were like overweight. And of course, those times there was very little sensitivity. So they were called fatty or motu or something in class, but they were like 3-4 kids who were like that, right? Maybe in a class of 40, you would have 2-3. But look at it now. Go to one of the Delhi schools now, Delhi private schools, okay? And just see the proportion of kids. You'll have a hard time finding kids who are actually not overweight. So if we are going to be like that, and we have a family history, and Indians in general are more prone, then I'm certain that we are going to get, diabetes much earlier. That's the only reason that we know of. There may be other environmental toxins and others that we don't understand yet. But yes, the primary reason is diet and lack of exercise.
Got it. So Dr. Mithil, you just used the word environmental toxins, etc. So my next question to you is, India is facing a major environmental challenge, both in terms of air pollution as well as pollution in water. Some parts of our country, we know that, are facing air qualities that are otherwise considered extremely harmful if it was another nation. Can this be one of the issues that is creating more diabetic population? And is there any link between pollution and diabetes?
So I think that's a great question again, because people would think that there is no, why should there be a link between pollution and diabetes? The link is between pollution and lung disease, between, lung allergies, bronchial asthma, bronchitis, chronic lung disease. Okay, maybe the heart because it's cold and it's polluted. So why diabetes?
Right.
So you have to understand there are two components. Number one, people with diabetes are much more prone to infections, right? So all that dramatically increases in this period. Hospitalizations for diabetes are much higher than those without diabetes. So during this period, again, simply because of pollution and infection. Now, but it's not that simple. It's not just that. Remember, there are two kinds of particles, PM10 and PM2.5, right? So if the 10 is the larger one, that creates lung and throat and eye and nose problems. 2.5 goes into the blood. Okay. And then it goes to all organs of the body. It excites inflammation in various organs. It will produce oxygen radical type of damage. And there will be possibly insulin deficiency as well as insulin resistance. That has been postulated. But it's thought that the overall increase in diabetes, roughly 14% of that is contributed to by pollution. So this pollution is, air pollution is not just causing lung problems. It's actually also causing an increase in metabolic problems like diabetes. And that may actually shorten the lifespan, a combination of all these. So as far as I'm concerned, as a chronic care physician endocrinologist, for me, air pollution is a huge thing because my patients are really getting affected. And as I said, understanding over the last few years says that actually diabetes can increase. The prevalence of diabetes and worsening of blood glucose can also happen simply because of pollution.
Got it. Dr. Mithil, one is pollution, but my question to you is, we have another problem that is increasing in India, which is cancer. Is there any correlation between diabetes and cancer? Is diabetes also leading towards cancer?
So there is a correlation, undoubtedly. Now, it's not clear whether it's a cause and effect, whether diabetes is the cause of cancer. But quite clearly, people with diabetes who are often more obese, often more insulin resistant, they are the ones who have a higher risk of cancer. There's no question about that. An association between diabetes and cancer is well established. Whether controlling diabetes will reduce the risk of cancer, we don't know that. But it's firmly there. Obesity and cancer, there is a clear association. Obesity and diabetes, there's a clear association. And people with diabetes obviously are obese and therefore get more cancer also. So yes, you're not wrong in saying that even the risk of cancer is more in people with diabetes.
Got it. Dr. Mithil, my next question to you is the one that I had asked you in my earlier interview as well. And I think people found it really, really useful. So I'm going to take the liberty of asking you this once more. It is considered that diabetes leads to blood pressure and cardiac problems. Now, is it true, or is it that the drugs that are prescribed for diabetes are the ones that may be leading to cardiac problems than just diabetes itself? What do the studies suggest?
So I think the studies are very clear on this, that I don't think there's any doubt at all. It is diabetes that causes organ complications. People often come to me and say when their kidneys are packed up that, I took so many medicines that my kidneys failed. I'm sorry, your kidneys failed. I'm sorry, but your kidneys failed because your diabetes was uncontrolled for the good part of 20 years, So it is blood glucose, circulating blood glucose that reaches the tissues, attaches to them, causes glycosylation, and a series, triggers a series of changes that causes damage to the organs. By and large, almost all the drugs that are approved for diabetes management will actually protect the organs. So some will be neutral, like some they can't harm. Okay, some will be neutral, like in the sense that they will not do anything to the organ themselves, but they will still control your glucose and therefore help your organs also. So that's indirect. But some will directly also go in that direction. So the myth that it's the drugs that are damaging us or sort of injuring our organs is really a myth. That's what it is. The point here is that, people like to believe this. And that's why they believe it. So I think we need to get off that really and worry. See, remember, all drugs can have side effects, right? But not organ damaging side effects by drugs for diabetes, number one. Number two, there are known side effects. They are well documented, well studied side effects. So your doctor will track them down. So when you go for your quarterly or 6-monthly review, the tests he asks you to do are not just for screening of diabetes complications, he also looks at any drug side effects.
Got it.
So it's not a problem.
Right. Now, what are some of the drugs? I know that there's a technological development that has already happened. And I believe there are some drugs that are not only helping you control your sugar levels, but also help you prevent damage towards conditions like cardiac, etc. Is that true?
I think I briefly alluded to that some drugs are neutral, but others, this whole field has changed in the last 10 years or so, or maybe even less actually, 7 or 8 years, where drugs that were originally developed to treat high blood glucose were found fortuitously to have a beneficial impact on the complications of diabetes, independent of their effect on blood glucose. So if you're taking some of the newer anti-diabetic drugs like SGLT2 inhibitors or GLP-1 agonists, and all of them are in regular use now, you will find that they will lower your glucose, they will help you lose some weight, some of them can help you lose a lot of weight, and they will protect your kidneys, they will protect your heart, and maybe even liver. And heart protection, again, is of two types. They protect you from heart attacks, but even more importantly and more convincingly, they protect the heart muscles from failing. So the reduction in heart failure with the new anti-diabetic drugs is a wonderful discovery. It has changed the way we treat diabetes.
Lovely. Do you think diabetes developed during pregnancy by women can be reversed?
So I'll tell you how the picture has changed in this. When we were studying, and for a long time we taught this, that by definition it is reversible diabetes, which it is. But we know now that it is a marker of future diabetes. So what happens is after delivery, it gets reversed almost always. But then it comes back in a few years when the young girls, when they get pregnant, and maybe 10 years later, then they put on a little bit of weight and the age is advancing. They're in their late 30s, 40s, they all often get diabetes. So we take that as a almost certain marker of future diabetes unless the lady takes strong corrective steps. The other thing that has happened is about pregnancy. One line is very important, that we never used to see this earlier. I'm putting this in perspective because people may think this is the norm. We never used to see girls with type 2 diabetes wanting to become pregnant. There was no girl with type 2 diabetes. They were always older women. Their families were complete. And now every day in the OPD, we are struggling with one or the other girl who's 24 years old, is already got type 2 diabetes, not type 1, not insulin deficiency, type 2 diabetes, and is planning pregnancy, and the whole drama goes on. So this is like not a very great situation. Again, this the early onset of diabetes is causing some young girls to get diabetes, polycystic ovary, obesity, diabetes, and then pregnancy. So that's a challenge. And then, of course, in those who don't have it, but get it during pregnancy, those who have family history, those who are older when they become pregnant, all those things, they lead to greater risk of developing diabetes during pregnancy, but also the fact that later on in life, they will again get it, even if it becomes okay.
Got it. You just mentioned that, young women who have got diabetes and they're looking to become pregnant, it's not a great situation. What would you mean by that? Is it dangerous for them?
No, what I mean is that, people are young and they want to get on with their life, and pregnancy is a source of joy for the whole family. But then it's all manageable. Okay, we manage them well. I mean, those who follow advice have no problem. But it becomes a hassle because they have to take insulin, they have to take metformin. So there's no need to be negative about that again. Outcomes are good even in that.
Right.
But the fact is that, it's something that you wouldn't want to get into. So if you were careful earlier on, the chances of your developing diabetes before you became pregnant are very low. What has happened is age at onset of diabetes has gone down and age of pregnancy has gone up. So people, urban Indians are not getting pregnant at 22, 21 now. They're getting pregnant at 35, often 34, So diabetes comes in between somewhere. So that's the problem.
I have a very interesting follow-up question. I hope it makes sense. That if a woman is diabetic, she's pregnant, she's given birth to a child, and there's this period where there is breastfeeding which is going on, and the mother is consuming these metformins, etc. How does it impact the baby? Does it impact the baby, and is it dangerous for the baby?
That's a very, very important question. There's a select list that we can use. Very limited drugs can be used during lactation. We cannot use the usual drugs that we're talking about. No, they're not permitted during pregnancy or lactation. The mainstay of treatment is insulin. And metformin can be used, one or two other drugs, but a lot of drugs go out of the window when you reach the zone of pregnancy and lactation. So you cannot use the usual drugs that you do.
Got it. So how is technology helping the early diagnosis and management of diabetes, leading to a better quality of lifestyle in today's day and age?
I think technology is playing a big role. Firstly, in managing diabetes, there's no question that in managing diabetes, the pandemic showed us the potential of technology, how much it can help us. Simply connecting with the patient. I'm not going into details of that, but via apps or via even whatever system you use has really changed the way. But the patient is much more empowered now. Of course, you can do your blood glucose as such, but you can use monitors that will monitor your glucose continuously. You have blood pressure. You have so many devices that can give you a sort of continuous data about your own body. And also the impact of what you eat and what it does to the blood glucose or other parameters. So that kind of thing was unimaginable. Medicine in our country was go to the doctor, he writes a prescription, you follow it and forget about it. But now people with diabetes are so much aware. The more aware sort of section of people are actually sometimes hyper aware, if I may say. So they become their own doctor. So I don't advocate that. But awareness about your body is very important and very helpful. Many years ago, Elliot Jocelyn said, the diabetic who knows most lives longest. Jocelyn founded the first diabetes clinic in the world in Boston. And so people who know about their body, their data are definitely better, because one size does not fit all. It helps the doctor also. So data helps a lot in all this. Data also helps you to realize how fit you are, and how to sort of, if you're sort of crossing the line, you're increasing your risk of diabetes again, right? Then at a different level, this is individual level, at a different level, large or big data helps us plan strategies. The impact of COVID, the impact of diabetes on COVID, impact of COVID on diabetes, all those things can be now done much more easily. Those kind of studies are very difficult. You can get 10 collaborators from different centers, put their data together. All those things can be done. So I think technology is proving to be a boon. I'll give you a small example. You walk into a specialist clinic these days, like I just finished the clinic now. So if you walk in, then you can get within half an hour, you can get your HbA1c, your blood glucose, your lipid profile, your kidney function test, your eye photograph, and your foot tested. So if you add the foot test, maybe not half an hour, maybe 1 hour for the whole thing. The whole thing. So when you reach your physician in the same vicinity, across the corridor, you find that you have all this data on you. You don't remember your numbers, you forgot to get a test done. So another way how technology, another example of screening for complications in technology. I was talking of fundus cameras. It's becoming the norm to have cameras which are operated by non-specialists, and where you can go into a clinic, get a fundus photo done, photograph of your retina done, and it can be transmitted to your doctor or to your ophthalmologist, who can see it, in 1 day, 2 days, whenever, and tick off, fine, no, needs to see me. So those are amazing things that are happening, and I see that happening more and more.
Lovely, lovely. I think that's very encouraging the way things are going. I mean, that's actually leading us to not be fearful of diabetes, but actually be able to manage it so that we can live better. Now, Dr. Mithil, how is India? I mean, we know that we spoke about India's the diabetic capital. Now, how is the country handling the diabetes challenge? I know you are the president of AIIMS, and you are very, very keenly involved in public health. What do you think still needs attention, and what, in your opinion, is something that the government and the private institutions need to do to make things better?
So I think some aspects have definitely improved a lot, changed a lot. For example, I think with the newer schemes of the government providing cheaper drugs, most people with diabetes cannot really sincerely say that they cannot treat their diabetes because the drugs are too expensive. Now, if you want the expensive drugs, the ones that I was mentioning just now, even some of them have become cheap now, then it's a different story. But, to manage diabetes adequately, as was being done till 10 years ago, the drug prices have really come down. Access to medication has definitely increased. People complain about insulin. Yes, it is still expensive, but it is cheaper than the rest of the world. So that is one angle that is looked after much better. The second aspect is that doctors are much better trained in diabetes now. Diabetes was in a corner. When I joined endocrinology in 1984, we were the first batch of DM endocrinology from All India Institute. So it was, and even then we thought diabetes was a small part of endocrinology, TK, that kind of thing. But diabetes has overwhelmed all of us. So physician training has helped a lot. Average physicians are much better aware of the protocols, about the algorithms, about diagnosis, about treatments. So while always there's huge scope for improvement, but the fact is that there is a big change in diabetes management. One of the problems, I'm still at the management part. One of the problems there is that there is a lack of insurance for outpatient treatment. So, all the best schemes, even the government's best schemes, don't typically or sometimes don't cover outpatient treatment enough. So it is to me as a doctor, purely as a doctor, it seems very strange that we are willing to reimburse several lakhs for a kidney transplant, several lakhs for a bypass surgery, but not a few thousand to keep that at bay. So, and if you talk to people, by and large, Indians, particularly worldwide, humans in general, they don't want to spend money on prevention and chronic care. They're willing to spend money when it comes to, a disaster or something serious. So I think that understanding is changing a lot, but that understanding has to be driven in that prevention is better than cure. Neither you nor your family, nor the society, nor the country can take care of all complications of diabetes in everybody. So we have to join hands and, do that. That is one part, the management part. So my grouse in this is that chronic care must be covered by insurance. There are challenges there. I'm aware of some of them, but some experts have to get together and sort this out. Insurance experts and others. That is one part. The second part, of course, is the prevention angle. Now, we say do this, do that. We are passing all the onus on to the to the person, to the individual. We are not taking societal or national onus for that. So I was once addressing the young boys and girls of Khalsa College, and about similar lifestyle. And they said, you tell us what should we eat. You're saying don't eat this, don't eat that. Where are the fruits available in the campus? Where is the healthy food that we can get for lunchtime? I mean, this is 15, 20 years ago. Maybe it has changed. But I know that for a fact that we all sort of gravitate towards unhealthy food if it should not be available. We call this a diabetogenic environment. If there's food lying all around, if there's, if I enter this room, and sometimes it happens, people in their happiness or gratitude will, bring cakes and, a lot of stuff, and it's just lying there, and I'm just talking to her there, and in between, thoda sa, without realizing you'll pick it up. So such food has to go away. There have to be, at least in schools, there have to be laws. There's food served in schools and around schools actually should be regulated. So I think that part is not being focused on. You go to any hospital, go to this hospital, any hospital, and there will be a health store downstairs, health food restaurant, there's a regular restaurant, and just see where the lines are, the queues are.
Right.
So maybe there should be no restaurant, there should only be health food. Unless we implement that, it'll always be that if the other option is there, people will go for it, and that's economically more profitable for the person investing in that. So they will keep on doing that. But if there are less options in there, then I think we owe it to our youth to do that, not just tell them do this, do that. I mean, we can't pass the whole onus on to the individual.
Got it.
It's not fair.
I think, the two things that I take away from this is that one, there has to be a mindset change. So it's not always about the government or the institution. It is about how the community reacts to it. And second is that you need to be a little more mindful about providing the healthy food and creating a scenario where anything which is certified as not healthy should not be available, especially in the places like school. I think that's a brilliant idea, sir.
A simple thing I'll tell you. I was in New York a few years ago before the pandemic, and we'd gone out and we hadn't eaten all day, and I came back and there was Starbucks and there was a brownie, and I was really hungry and I was enjoying the coffee. I wanted to have something with it, and everything was labeled by number of calories. I could not bring myself to eat a 500 calorie brownie.
Right.
Because it was just stuck there. 500. Let's look for something else. So even food labeling, if it's honestly done, will make a big difference.
Yeah, absolutely. I mean, we have to play on the psychology and that guilt of consuming something knowingly that it is not good for you.
Yes.
Dr. Mittal, what are the 5 tips that you would like to share with our audience to help them understand? These tips are specifically for people who are diabetic, as to how they can lead a happy, good quality, long life.
So the first tip is to remain positive. Getting diagnosed with diabetes is not a sentence for life. It's not, you're not put in a cage or anything. You lead a normal, healthy life like everyone should lead. Therefore, if you have type 2 diabetes, for whatever reason it came on early or whatever, you still can manage with a very good outcome, very good lifestyle, very healthy. You can enjoy all the good things of life. So that is very important, because it's sometimes, I remember one senior cabinet minister said that, I've learned how to deal with diabetes. It's like getting a new pair of glasses. You have to learn to live with them. Every time you change a pair of glasses. So you have to learn to live with it, and you can live with it very comfortably. So that's number one. The second point is that, yes, there is no substitute for a healthy diet. It's very important for all to have a healthy diet, whether people with diabetes, without diabetes, and in a family where people are diabetic, anyone is diabetic, everyone should be having the same diet. That's very important. I have this, there's this one guy who's got diabetes and everyone is chasing him down. The whole family is sort of attacking him in my presence, in the doctor's presence, that, this guy does that. And they're all like at least 20, 30 kg overweight. Why don't you all look after yourself also, So healthy diet, which I've already outlined, less refined sugar, more fiber, more protein. So one, positive attitude. Second, healthy diet. Don't forget the protein part in the healthy diet. That's also very, very important. Adequate protein is very important for a healthy diet. There are no absolutes. There is no magic in the diet. That I only have fruits, so I don't give up fruits completely. All those crazy things don't work. Or I give up wheat, or I give up, turn vegan and everything that will solve my diabetes. No, it won't. All studies have suggested that. Third is physical activity, which has taken a backseat in urban lifestyles, that people used to walk to get their food or to get their water. Now we have to take out time for the same activity because we are so busy, all things are provided. So we have to factor in some time for ourselves when we plan our day. When we are young and very, very enthusiastic, and that's natural, we would want everyone to work very hard and go sort of very, very high in their career and profession. But the fact is that you have to factor that in. As a teacher in management, and something that I break every day, I flout every day, is that don't have your appointments back to back. Give a 5-minute gap, 10-minute gap. Keep some lag time, between meetings. So similarly, when you plan your day, you need to have some time which is given for physical activity. Meanwhile, as much physical activity as you can have profits. Wherever you can walk, you walk. Don't sit for too long. Don't sit for too long. Use the Pomodoro technique. Every 25 minutes or 28 minutes, take a walk, come back. Go and meet a colleague, say hi to somebody, go across and see what the other staff is doing, things like that. Just don't sink into that chair. Sitting is the new smoking. Okay? And take the steps if possible. Avoid the elevator wherever you can. So physical activity is the third point. The fourth point is adequate sleep. Something totally negative. There may be some gifted, who can manage with like 5 hours or something. Don't challenge yourself to be like that. And sleeping at time, it's very boring. And what grandmothers told us, we need to sleep early and get up early is the healthiest thing. But even if you can't do that always, make sure your sleep hours are complete. And the last point is about stress. So how to combat stress? You may find your own way. But one definitely is physical activity. It's difficult to combat stress just by indoor physical activity, I feel. But I think nature is a very big stress buster. And, those who live in cities like Delhi, where even though pollution is very bad these days, but otherwise Delhi has amazing parks and even city forests. So those are amazing areas to go into. The stress busters, listening to music, reading. Reading is something that people have forgotten. And of course, just passing time with friends occasionally on the weekend or something. So I think those things will make your life fulfilling. And I don't think diabetes will be able to pull you down.
Got it. So before I let you go, what is your message to the diabetics on the World Diabetic Day?
So I think the important point that every person with diabetes should understand is that it's not a disease you can outsource to your doctor. You have to take charge of your disease. And the message is that it's like, it's like you are the player and the doctor and the treating team is the coach. So on the pitch, you have to play your strokes. So you better talk to the doctor, chew their brains, talk to the educator, understand everything, read. Then you are well empowered to do that. I think you are the best person to take care of your diabetes, and we will help you to do it. That's the way we should go forward.
Lovely. I think with that lovely message, I want to thank you so much for taking out time. I know you have a very, very busy schedule, but you still always take out time, and that shows your commitment to creating the awareness. And I really, really appreciate that. Thank you so much for joining us, Dr. Amrish Mittal.
Thank you. Thank you. Thank you.
Cheers.
One of the comorbidities and high risk factors of diabetes is the diabetic foot, or what is known as the diabetic foot ulcer. Now, to tell us what is a diabetic foot and what triggers it, we have with us Dr. Ashok Damer, Senior Consultant, Diabetic Foot and Wound Care, BLK Max Super Speciality Hospital, New Delhi.
My next guest is Dr. Ashok Damer. Dr. Damer is a Senior Consultant for Podiatry and Wound Care at BLK Max Hospital, New Delhi. He is a reputed name in this field in north of India. Apart from his knowledge and experience, he is also known for his patient-centric approach, and he is someone who's very passionate about the prevention of amputation of lower limb. Dr. Damer has written a lot of articles and has authored books in this field of his expertise. Dr. Damer, welcome to BW Healthcare World. It's the World Diabetes Day, and our conversation is related to diabetes and the challenges that diabetes creates. Now, diabetic foot is one of the greatest fear for any diabetic, but not many diabetics are aware of what exactly is a diabetic foot, what are the complications, and what are the conditions that actually form a diabetic foot. So can you explain for a layman as to what diabetic foot means?
Yeah, diabetic foot, I would say that it is a very important and devastating complication of diabetes. The diabetes is known for its complication. And for the layman, I can say any problem related to feet in a diabetic patient, you can label it to the diabetic foot, right? Grossly, we can divide that usually it is because of damage to the nerve, which is known as neuropathy, damage to the blockage of the arteries, which is known as vasculopathy or peripheral vascular disease. And the third, I would like to separate it is a diabetic foot ulcer, which are most of the time non-healing and they create a lot of problems. As far as sensory neuropathy is concerned, it is usually the bilateral symmetrical and it is ascending. The patient will typically say that first of to start with, there was numbness of the toes, which came to the feet, and then subsequently came to the ankle, then it is ascending. And after reaching up to the mid-calf level, you can say they start feeling numbness of the hands. So this is the ascending, I would say it is a stocking and glow type of anesthesia or the neuropathy. Then neuropathy can have other symptoms also. Maybe you can grossly divide it to, one is the positive symptom with the positive symptom, other with the negative symptom. Positive symptom means when the patient has pain in the feet, burning feet, then lancinating pain, and they can have dull aching pain also, then claudication, which is maybe also there. And the negative symptoms are numbness of feet, which is very common and very devastating, because if the diabetic patient, most of the time they get neuropathy after 5-10 years, I would say, they get their numbness of feet, which leads to different complications, which I'm going to tell you in detail. Then we come to the second part, that is the vasculopathy or blockage of the arteries. The symptom of blockage of artery can be claudication. Claudication means patients would say that when he starts walking, there is no pain. But after a certain distance, he starts feeling pain, which keeps on increasing as he keeps walking. If he stops in between, then he gets relief. And if he starts again, the pain again starts. This is the typical claudication of the, it can be of thighs, can be legs and the feet also. So this is one of the features of the blockage of the artery. And even sometimes numbness or tiredness also. Patient says, when we start walking, so we are perfectly all right and healthy and agile. But after some time, I start feeling weak after even little bit distance. So this is also the feature can be of the blockage of the artery. And the third, grossly, another thing is in the vasculopathy, there may be shiny skin, loss of hair, because the hair also do not get nutrition through the arteries, so one can get shiny skin. And of course, the diabetic foot ulcer, which I told you, they may be of the gangrenous type. If vasculopathy is more prominent, then the arteries are clogged, so there is a gangrene. Gangrene is a blackening of the toes or feet or even the legs, and which may be detrimental. One can lose his legs or even life also. So these are the different signs and symptoms of the diabetic foot.
So what actually happens inside the body physiology that causes this diabetic foot, sir?
Yeah. As I told you, grossly, we can divide diabetic neuropathy and diabetic vasculopathy. Neuropathy means damage to the nerves, right? The vasa nervosa, that means the nerve arteries, small arteries which supply to the nerves, they get clogged because in general, all body arteries, they get clogged because of accelerated atherosclerosis. Atherosclerosis means narrowing of the fatty deposition in the artery. So when the small arteries which supply blood to the nerves get blocked, so nerves get gradually damaged. So that causes neuropathy, that loss of sensation and the pain, as I told you, different type of pains, positive or negative symptom. And similarly for vasculopathy, as the arteries, they get blocked. So if the arteries of the brain are blocked, they are known as cerebrovascular disease. The one can get stroke, paralysis or time. If the arteries of the heart are blocked, then one get heart attack, angina, heart failure, etc. If arteries of the lower limb are blocked, then one gets the claudication, then ulcer, non-healing ulcer, which are blackish in color. They may be having malodor also, and one can have to lose the toes or the limbs, etc., etc. So that is the reason. So I would say the basic reason of all the problem in the diabetic is the clogging of the artery, maybe smaller, leading to the vasa nerve, known as vasa nervosa, and subsequently blockage of the other arteries.
Got it. Thank you, sir. So we know that we are the diabetic capital of the world. And does this also mean that we are the capital of diabetic foot cases? And is there a rise in the number of diabetic foot related ailments in India, or do you think people are ignorant or are they careless?
I would say all these factors are important as far as diabetic foot incidence or prevalence is concerned. And as you have rightly told that India is the diabetic capital of the world, and day by day the number of diabetics are increasing. At the moment, by rough estimate, 75 to 80 million diabetics are there in India, right? So you can say 160 million feet, they are prone to get diabetic foot problems. So since the number of diabetes are increasing, so diabetic feet problem and diabetic foot problems are also increasing. Another is that we are negligent also, particularly in the south. They have the tendency of wearing not to wear the chappals, bare feet walking. That is very important. Then in North India also and other part of the India also, we take or we rather give the minimal possible attention to our feet. We take care of our face, keep washing number of times than other parts of the body, but we do not bother about our feet. That negligence and not wearing chappals, not taking care of your feet, not getting your blood pressure, sugar control leads to the diabetic foot problems.
Right. So you mentioned about gangrene, that it is a blackening of toe. Can you explain what exactly is gangrene and what causes gangrene to happen?
Yeah. Gangrene means death of the tissue, right? And why there is death? Because the blood supplying to that particular area gets compromised. It may be because of atherosclerosis, which is increase in the diabetic patient, blockage of the artery. Then it can be because of the compartment syndrome also. Compartment means suppose there is an abscess in the foot. So whatever the distal arteries are there, distal vessels are there, because of the compression, because there are certain compartments in our feet. So once the abscess is there, it keeps on increasing, but the space is limited. So it compresses the artery. And the feet artery, mind it, the distal feet arteries are and arteries. What are the and arteries? And arteries are those and arteries which do not have branches. So if they are compressed at one proximal place, then the whole of the artery is blocked, which leads to the death of the tissue. So accordingly, you must have seen the patient come typically with you that there was only a black patch over one of the toe, which kept on increasing. Then whole of the great toe is enrolled. Now the second toe is also becoming black. Then subsequently they say all the four toes have become black and it has extended proximally. So the basic reason of the gangrene is the blockage of the arteries of the lower limb.
Right. Dr. Damir, most of the time people do not know that they are heading for this problem because it doesn't come to their notice. What are the early signs that any diabetic should be worried of to understand that the person could be heading for a diabetic foot problem and needs to consult a doctor?
Yeah. There are certain warning signs. First and the foremost is the numbness of the feet, which is the most common symptom. I would say that as soon as you start feeling numb in your feet, which is gradually increasing proximally, then you should go to your dermatologist or the podiatrist, foot specialist, and get your feet tested properly. Rather, I suggest all of my doctors as well as the patient that whenever the patient of diabetes comes for the first time to the doctor, they should thoroughly examine his or her feet. And then subsequently, if there is no problem, every year, diabetic patient should get his feet examined. And let me tell you, if the problem is more than one, as the doctor suggests, every month or every 3 months, you need to get your feet tested. Then if you are getting pain in your feet, particularly claudication, so when you used to walk earlier, there was no problem, but now as you start walking, the pain starts increasing, which may be in the thigh, in the legs, in the feet. And then if you stop, then pain disappears. So this is the another warning sign. Yes, there's your arteries may be clogged because of the diabetes. So reach your doctor as early as possible. Another thing is, even if the small trivial ulcer of your foot, it should also warn you it can become very dangerous. It may increase overnight. It may cause gangrene, and then you may have to lose your limbs or legs or even life. So these are the certain warning signs. You should be cautious about it.
So, Dr. Damir, what are the therapies and treatments available for a diabetic foot?
Yeah. So again, it depends that what symptom patient comes with, right? If the patient has numbness of feet, then we want to see sometimes B12 deficiency, one of the vitamin, which is a neurotropic vitamin. Then B2, B6, they are also neurotropic vitamin. Their deficiency in a diabetic patient may also augment the loss of sensation, which is because of the peripheral neuropathy, right? So we sometimes take care of that after getting their blood test done. And then if there is a pain, then the tramadol or this type of painkillers are given. Usually we give the painkiller which do not harm the kidney, because diabetic patients are always at risk of losing kidneys. So I would like to suggest here my diabetic patients that if you are having leg pains very frequently, maybe rest pain, or when you are lying, you are going to sleep, before that you are feeling pain in your legs, then it is better you get yourself tested. And you should take the medicine which should not damage to your kidney, like Voveran or Combiflam. I would like to name certain medicines which may damage your kidneys also. So go for a combination of tramadol plus paracetamol, which is a very safe analgesic, which are safe for the kidney, and they are very effective. Then certain epileptics, anti-epileptics are also there. Say gabapentin, pregabalin is also there, and some duloxetine is antidepressants are also there. They also help in different neuropathy symptoms. And as far as vasculopathy or arterial system problem is concerned, then definitely we suggest to take after 50, 60 years of age, if there are some high risk cases, particularly the person who smokes. So let me tell you, the one has to stop smoking also. They are also prone for atherosclerosis, so we give them blood thinners like aspirin or clopidogrel. Then another important aspect is of statin, giving the cholesterol lowering medicine. So the patient's cholesterol should not be on the higher side. Then one should take care of the blood pressure also. One has to take ACE inhibitor or ARBs, which are better because they save your kidneys also. So these are the medicines which can be given, of course, by a doctor. But mind it that you should not start taking medicine as your colleague is taking, your neighbor is taking, because it may be harmful. A medicine which is good for him may not be good for you. Rather, it may cause certain side effects, which may be detrimental later on in your life.
Now, that's a very important point that you have shared, that every body is different. So one medicine work for one person may not necessarily work for another person.
The patient says, Doctor Saab, he is taking only half tablet. His sugar is under half. He is control under half. With the half tablet, you are giving me 4 injections. So as you can give the example that as our hand has a different size of the fingers. So similarly, each patient has a different level of sugar control. So you cannot say that all patient can be treated with a half tablet. And more so, mind it, Another question, another myth later on, I can tell you a wrong notion. This is very common in the diabetic patient, that they say, doc, my colleague, he has gone to the doctor 4 years back. He takes only half tablet and there is no problem. The reason is they don't go to the doctor. And once they land up with the problem, they lose their limbs, they lose their kidney, eyes, heart, and they die very badly. So never ever think, never ever compare your diabetes or your disease condition with the other fellow.
Got it. Got it. So, what, in your opinion, should people with diabetes do to prevent a diabetic foot?
Yeah, it depends. First and foremost is the diabetes itself. Control your blood sugar, because that is the root cause of each and every problem. It has been seen by different researchers that the patients who have poor control of diabetes for number of years, they'll end up with the diabetic foot, kidney failure, heart attack, paralysis, and all sort of problems. So diabetes control is number one. Second is control your blood pressure, because increase in blood pressure also causes problem more so with your peripheral vascular disease, and then heart attack, stroke, etc. there. And the third and the foremost thing is to control your cholesterol also, because the cholesterol also causes more clogging of the arteries, which may lead to all this problem. And then, of course, the regular exercise, going regular to the doctor, that is important. Get yourself different tests done regularly. Because sometimes, as I told you, that the patient says, no, sir, my colleague, he has not get his examined, has any test done for 4 years, he is LNRT, no problem. Because they don't know, they do not go to doctor, they don't get their blood sugar checked up. So that's why they are relaxed. Because another thing which very important I want to tell you, that the diabetes is a silent killer. In the most of the problems, in the most of the cases, rather, different system involvement, there is no pain in the feet, you can say, no pain in the heart at the time of heart attack. They lose their kidneys, they sleep in the night, in the morning they see that they have become one-eyed, they become blind, suddenly they get stroke. So the diabetics patient, they should be aware that the things are going on, creeping on slowly. So until otherwise, they are going to get themselves checked up, they get their blood sugar done regularly, 3-month blood sugar control, that is known as HbA1c, glycoside, that is also important. So this is how you can stop getting all these complications.
Right. Dr. Damer, does a person's weight also affect the feet?
Yeah, it definitely makes difference, because what happens that if the patient has a flat feet problem, or if he has a varicose veins problem, right? Or he has an osteoarthritis, if he is more obese, then chances are there all these problems will further increase. Another thing is, if he is more obese, he will be become more sedentary. So more sedentary means more sugar. His sugar will not be under control, because exercise is a very important part of the treatment or management part of the diabetes. So obesity definitely makes problem with each and every disease or any complication of diabetes.
Dr. Damer, there are certain questions which have been given to us by the audience. One is that, is it okay for a diabetic person to soak feet in the water for a long time? Also, is it people with diabetes, can they get pedicure done? And what precautions should they take if they were to go for a pedicure?
This is very interesting and very important question. Let me tell you, I get a number of patients. They come to me after going to the pedicure guy. I strongly recommend a diabetic patient should never go for a pedicure. Why? Because the persons whosoever has been giving you pedicure, they don't know, they are not a doctor, they don't know the details of the diabetes, because the diabetic patient, they have their skin which is very thin and supple. They may rub it, they may give all sort of cosmetic application and all this, and sometimes they may be harsh to the skin also. So they come to me with the different type of ulcers. Another thing is infection, chance of infection. Because whatever equipment we use in the hospital or at clinic setting, it is autoclaved. It is totally bacterial. But in the pedicure clinics, they just keep it, they just clean it with the water, right? And then look-wise, you say, okay, everything is good. No, it may have bacteria. And if your colleague who is a non-diabetic, if he gets pedicure, he will not get any problem. But you can get. Why? Because your body resistance is low. The bacteria and viruses, whatever they are they can stick to your skin and you can land up with a skin infection, fungal infection, which is not uncommon. And as I told you that even if you have to do some massage, etc., which I tell to my patient, that they should do it gently, because skin is soft and supple. So if they do it harshly or because of any reason or somebody else does, so they may get ulcers. So one should not go to pedicure, a diabetic patient.
Got it. Got it.
For that, you can come to me. I would say I'm a podiatrist. I'll take care of that. Say for nails, one thing I would like to tell, the paring the nail, for that also sometimes they go to the barber or pedicure guys, they do. What happens that the nail should not be pared at the angle. They should not be cut at the angle. They should be kept straight. And they should be kept little bit longer than the nail, that the toe. Not extending beyond the toe, but more than what you do normally, that is without diabetes. Why? Because if you are going to cut the corners of the nail, then there are chances of ingrown toenail. Also not a uncommon problem in the diabetes. So always cut your nails straight. Go to a podiatrist for the, because another thing is in old patient there are a lot of fungal infection of the nail is there. So nail becomes very thick, brittle, and their fungal involvement causes easily they get detached also. So let the podiatrist handle this thing. Nowadays we have foot specialists also in Delhi. So I think you should consult them.
Got it. This is very important that you shared with us. And you spoke about fungus. Now, what must be done if a person has an athletic foot fungus?
Yeah. First of all, prevention, I would like to say. One, in your community, I would say, 6, they go to the Gurdwara, right? And Muslim also go to the masjid, sometimes Hindus also. So just before the their worship place, there is a trough, common water trough is there, as in Bangla Sahib Gurdwara we have, right? So suppose I'm going with my wife or my son, who are not diabetic, I am a diabetic. I'll soak my feet, they will also soak their feet. They will not get any problem. The moment I'll move ahead, or when I come to home or after a couple, I'll see I'm getting fungus infection. I've got the warts, which are viral. They are also not known. Why? Because my body has low resistance. Being a diabetic, my body resistance is low. So what happens before you? Who knows? The person who has washed his feet in that trough might be having some infection, isn't it? So what I recommend here to the all 6 and Hindu or Muslim, whosoever to do this type of ritual, do your ritual. But as they have done in Bangla Sahib Gurdwara, there are taps also on the side. So you wash your feet there and then enter inside the Gurdwara or the religious place, right? So one is and another thing is the persons who are very interested in going to swimming pool, etc. So in the wet places, you should never walk barefoot, right? You have to wear some socks, special plastic socks or whatever rubber socks are there for the swimmer, so that you don't wet it. Another thing is keep your blood sugar checked up. If your blood sugar is going to be high, you are likely to get the fungal infection. And another point is that keep your interdigital area, that is the area between the 2 toes, dry. Whenever you take bath, clean your feet thoroughly, then dry whole of the skin, particularly the skin between the toes, and then sprinkle the common powder, which we use sprinkle powder. Use sprinkle powder there. And if you have the fungal infection, definitely your doctor is going to tell you about the antifungal powder there. So these are the way. Then trim your nails properly. Then don't wear the shoes, old one, dirty one, because there are chances that if your shoe pair, the pair of the shoe is inside the wardrobe for a number of years or number of months, sometimes we take out them and then wear it. So there might be fungus inside, which will catch you. So these are the small things. If one takes care of, so then one can avoid the fungal infection. But very important is diabetes control.
Right. So, but in case a person has got athletic foot fungus, then what does he do?
Then he should go to the doctor. Then we give antifungal powders are there. Certain creams are also there, which are to be applied. And as I told you that they have to change their socks at least twice a day. And every 3rd day, they should change their shoe wear also, right? And this is all things. And then don't let your feet remain wet, particularly in the rainy season or in the summer also when there's a lot of sweat is there. And wear the cotton socks not the nylon one, right? This is also important.
Right. So there are people who get their feet cold. Now, does that mean that there is a lack of circulation there, or could this lead to, or could this be a sign of a diabetic foot?
Yeah. This is one of the sign of the diabetic foot, which I couldn't mention. Because what happens, because of the poor circulation, diabetic patient may feel that their feet, their legs are cold. Always, they will typically say, if I have always my feet are cold, my legs are, and that is the reason because the blood circulation is poor. And you know the blood circulation causes warmth of the skin. So that is the reason. It is because of the peripheral vascular disease. That is a very important symptom of the, even the sign also. If you touch the back of the hand, the skin of the diabetic patient, legs or feet, if they are cold, then chances are there that the patient might be having peripheral vascular disease. He should consult the doctor.
Got it. Dr. Damer, you mentioned about socks and shoes. Are there any tips related to socks and shoes for diabetics, especially for people living in India? Are there any specific types of shoes that the diabetics must wear?
Yeah, definitely. Say the diabetics should know that what type of shoes they have to wear, right? The shoe should not be of high heel, particularly to the ladies and the girls, because it causes undue pressure on the forefoot. Then the outer sole, it should be hard. And inner sole should be soft, right? Outer sole should be hard because they have in today only I got a patient who had a nail prick through the shoe, a chappal he was wearing, which was a very soft one. And he was having insensate feet. He was not knowing. And after 4 or 5 days, so that is how they came to me, ki, doc, this has happened. So you understand? So outer sole of the shoe wear should be hard, right? And the inner sole should be soft. Why? Because the diabetic patient, they have neuropathy, they have dryness of the skin. So whatever they develop more so corn, calluses, and then pad of the fat, which they have under the feet, which everybody has it, it is lost. So they should wear a soft insole and the outer sole should be hard. Another thing is that the tip of the shoe should not be very narrow. It should be broad. Then the toe box, the area of the shoe which has the toes of the feet, they should be wide. Wide toe box, it should not be narrow, no high heel, hard external this thing, outer sole. And then it should be, there should be garter also. Garter means the cover part of the shoe which covers the back of the heel, right? That is why I prefer that one should not wear the chappal. I do not recommend diabetic to wear the flip flop or this chappals type of thing. Baddi wali chappaleं जो होती हैं, I would not prefer my patient to wear it. So these are the things, and the shoe should be, I would say, airy, and the laces shoes are always preferred, right? And then they should not be very much of the hard leather. And as far as socks are concerned, socks, we have special diabetic socks also, which have a application of, I would say, silicone at the plantar surface. Then they do not have seam, because sometimes the skin is so soft, so supple that even the seam of the sock can cause ulcer, can cause some small abrasion and can cause the ulcer. So they should be seamless. Then the mouth of the sock should not be very tight, because it can compromise the circulation also, right? And then again, in the summer, you should wear the cotton one, and in the winter, you should wear the woolen one, not the nylon. So never wear the nylon socks, right? These are the things which has to be taken care of whenever the diabetic chooses the shoe and socks. One more point I would like to say, while you go to buy your shoe, always buy the shoe in the evening, not in the morning, right? Because in the evening, everybody has some sort of swelling, or the size of the feet increases because of the continuous standing and all this. So other guys, it doesn't make difference. But if the diabetic, if he purchases the shoe in the morning hour, in the evening hour, what will happen? That his feet are going to little bit swell, which may cause little bit pressure on the feet. But once he is not aware of his sensation, so he'll keep on wearing it, and ultimately he will see, or somebody else will see, that he started some shoe bite, some ulcer in the feet. So always buy the shoe in the evening hours.
That's very important.
Yeah.
Sir. Dr. Damer, you had mentioned that there were some myths that you wanted to share. So what are some of the myths related to diabetic foot?
Yeah. One very common myth is there that if feet do not hurt, then nothing to worry. As I told you that a diabetic patient, most of the time, they have sensory neuropathy. So they are not aware of any small insult to the feet in form of small cut or any pinprick or any splinter is there or any nail is there. So anything which is going to damage his feet, or even the feet, but the ground can be very warm. I have one example of one of Saji at Rajendra Nagar, rather in Patel Nagar area. In the in the summertime, sorry, in the month of May, he attended his grandson's birthday, right? He kept on walking, enjoying the things, and everybody was enjoying. But in the night, when he went to home, so all his attendant or his son and daughter-in-law, they were worried that there was blood everywhere and his feet were totally covered with the ulcers. So the reason was, since we know, even it can happen in the religious place also. Say in the Gurdwara, in the Mandir, in the Masjid also, we walk bare feet. So what happens if you go in the on the this thing on the warm floor, then you can get the burn. So I would recommend that if you have to go to the religious place, go in the morning or in the evening. Because in the day hour, you can't go with your shoes inside, the socks inside. So it is better to go in the morning or the evening so that your feet do not get hurt or do not get the burn. So these are the things which is to be taken care of.
Right.
Another thing is, and because of the neuropathy, one could hurt. So one should examine the feet also daily. And as we have the simple ritual, I would say in the Hindu religion, that children, they should touch the feet of their parents or their father daily in the night. Why? Because it has been seen that the diabetic patient who has peripheral neuropathy, who has insensate feet, so they they will not come to know about any cut or any burn or any abscess or ulcer, etc. So I recommend my all patient, today also I recommend a number of my patient and their attendant, that the patient's son or someone who is young should examine the feet of the patient in the night before going to bed, so that if there is any cut, any abrasion or any swelling, any redness is there, they can take care of it and they can contact the doctor. So mind it, if the things are not hurting your feet, that is more dangerous situation rather than you don't worry about it. Another thing is, people say if there is a diabetic patient is sedentary, nothing to worry. But let me tell you, if a diabetic remains sedentary, first thing is his sugar may be increasing. Second thing, even in the sedentary condition, say patient is confined to bed or moving only in the house, not going outside. In the night, if he gets up and going for a toilet, he can bump his feet with the wall, with the furniture, etc. Another thing is, there may be something on the ground, in the floor of the house also. So mind it that sedentary people can also get problem, and then shoe bite can also be there. If they are going somewhere, they are wearing a shoe which are tight, but because of the insensate feet, they will not come to know, and ultimately they get the shoe bite. Another myth is, let me tell some few myths about the diabetic foot ulcers. Usually what happens in earlier days, and when we were also kids, we were told that keep the wound open once it is there. But in diabetic patient, one should not keep the wound open. That air is better to heal. No, it is not, because the air has the germs also. And the diabetic patient, because their body immunity is low, so the germs, they stick to the wound and the one can get infection. And so in the diabetic patient, whenever there is a wound, they should cover it with the proper dressing, and change it as and when the doctor says so. And the third thing is, another myth is that soaking a wound helps it to heal. Mind it that that may be true in America. I studied there in Chicago in 2007 and 8 podiatry. Because if anybody who has been to America, the tap water is their drinking water. They have such a system that the tap water is a drinking water. But while in India, we see, as far as drinking water is concerned, in the morning, if you see that the MCD or other agencies water, if you open the tap in the morning, a lot of dust comes out, right? Even in the day also, you must be showing. So how can you think that the cleaning with that water, your wound is not going to infect it? So this is my principle that I tell all my patients, that never ever clean your wound with the tap water. Always use the normal saline or betadine, or as suggested by your doctor. Another thing is that sometimes another myth with the diabetic says ki if there is a wound, then disinfect with the alcohol. No, because alcohol, what the alcohol is going to do, it may kill the bacteria, but simultaneously it is going to kill the normal skin also. So don't clean the wound with the alcohol. And another thing is, if wound occurs, then some say ki, okay, just wait and see. Then we'll go to doctor. Just wait for, they keep applying the different this thing, ointment or the betadine or small thing. Actually, they are not a wound care specialist. How can they do it? And then they keep applying other things like desi things also, some sort of powders, or so they may also harm the wound. So never ever think that, okay, wait and watch. As far as diabetic foot ulcer may be dangerous, you may have to lose your toes, feet, or even the legs, and even the life also. And 95% of the wound, let me tell you one thing I would like, diabetic foot ulcer are preceded by a small ulcer, trivial ulcer. A small ulcer leads to the amputation or to the death. So mind it, even if the small ulcer is there, immediately contact your healthcare provider and take the treatment. These are the common myths.
So at what point in time do we need to necessarily go for an amputation?
It depends. If your arteries are permanently clogged, what happens? Suppose a patient comes to me with the gangrene, right? Is the toes are black, or the one of the foot is black, or the leg is black. Infection is the reason which clogs the arteries faster also. So first of all, I'll try to remove the infection. And second thing is, I'll try to open up the arteries. As we have for the heart angioplasty bypass, similarly, there are angioplasty and bypass surgeries for the legs, and arteries are also there, right? So by getting the arteries open, by taking care of the infection, then certain vasodilators are there which are given to open up the arteries, and then certain painkillers are there. Then certain molecules are there who make the RBC or red blood cells more flexible, right? So blood thinners are also given. Anti-cholesterol medicines are given. So these are the way how we can avoid the gangrene. And foremost is the control of your blood sugar, not walking bare feet, taking care of your feet regularly.
Got it. Sir, thank you so much for all your time, because these are very, very important questions that you have answered. But before I let you go, what is your message to the world on the World Diabetes Day?
Yeah. And the World Diabetes Day, I would like to say, since the diabetes is increasing leaps and bounds all over the world, particularly in India. So you should remember the 4 pillars of the diabetes control. One is the diet. The diet, you should take the whole grains, leafy vegetables, fruits, salad, right? Then second pillar is the exercise. So 150-minute exercise per week. That means 30 to 45 minutes. Brisk walk is sufficient. You can do power exercises also, weightlifting, etc. also. But the simplest, and which does not cost you a lot rather, not a penny. So that is a simple walk, brisk walking, right? And the third thing is the medicines. So go regularly to the doctor, get your all tests done regularly, your HbA1c 3-month diabetes control, then fasting and PP blood sugar as advised by the doctor, your cholesterol levels. So all these things are to be taken care of regularly, and get your blood test done regularly as per advice by your doctor. And the foremost important, which is most important, is the meditation. As we Indians, we always prefer for yoga and going to the temple, going to Gurudwara and other worship places. That gives us the peace of the mind. And let me tell you, most common precipitating factor to get diabetes nowadays is the mental stress. If the patient say, my parents are diabetic, if I'm relaxed man doing exercise or taking care of my weight, this, I will not be having. But my brother, who is just opposite, he always tense, worried about his job, worried about his studies, worried about his kids, and etc. running morning, evening, not going for the walk, taking all sort of junk food, then he's likely to get diabetes. You understand? Both parents are diabetic, but one is becoming known, other is that. So the stress levels, they are to be curtailed. They are most important part of the management of that.
Right.
This is my message.
So the four things that I understand is, one is, if you're diabetic, get your tests done regularly, keep it under control, have the right food, exercise, and last but not the least is be
Drugs and meditation.
stress-free and meditate yourself.
Yeah, that's
So
right.
thank you so much for all these nuggets. It's such a beautiful information, and I'm sure that, while we are the diabetic population, capital of the world, but if we are taking care of our health, even if we have diabetes, if we take care, we can still live a quality life.
Yeah, that is why, Mr. Naru, I would like to say that I have written two books. One is Hindi, that is Madhumeh Kaise Jiye Masti Se, and another is Diabetes, How to Enjoy with Diabetes. So you can enjoy the diabetes. That's right. There are certain only adjustment are there. It's nothing like that. Once you get diabetes, it's the end of the life. Now what we are going to do? Nothing like. Only thing is we have to be little bit more cautious about eating, do regular exercise, go to your doctor, then you can live happily without any complication. For number, I have patients who are diabetic for 40 years without any complication. But most of the patients are other way around. Because what happens, 5-10 days, everybody says, I can also do, say I got cough, so I'll say, yeah, okay, I will not take any ghee, tel, tali, tikni cheezein or oily food for 5-10 days. But once you have to do it regularly throughout your life, there is a problem. Or they, okay, I'll leave it. Whatever will happen, we'll see. And subsequently they curse to their fate. Yeah, Bhagwan ne hamare sath kya kar diya, what we did, why we lost our kidneys, why my feet are being cut, I got heart attack, I got stroke, I cannot move my limbs. So we always curse to the God, to not to ourselves, that who have been responsible for high blood sugar for number of years.
Right.
So this is the point.
Great, sir. Thank you so much for your time, and appreciate you joining us at BW Healthcare World.
Thank you.
Diabetes in children is also surging. Now, as bizarre as it may sound, not only type 1, but even type 2 diabetes is being seen in the young ones. Now, to tell us why is it happening and what comes forward, we have with us Dr. C.M. Batra, Senior Consultant Endocrinology, Indraprastha Apollo Hospital, New Delhi. Dr. Batra, when we talk about diabetes, we guess or we talk about people in their 40s, late 50s with obesity, lifestyle disorders causing diabetes. So that's the picture that we have in our minds. But we don't picture children, adolescent children in that diabetes framework. So tell us, what is type 1 diabetes and what are its causes?
Basically, children with diabetes not only have type 1 diabetes, these days we are seeing more and more obesity related type 2 diabetes in children also. Children as young as 8 years old, 9 years old, because of obesity are developing type 2 diabetes also. So, and of course, in children, you have another type of diabetes called maturity onset diabetes of the young, called MODY. And there is another type of diabetes called genetic syndromes. Basically, you can have diabetes in a child which is less than 1 month old also. It's called neonatal diabetes, which is basically genetic. So there are 4 types of diabetes which can occur in children: type 1, type 2, MODY, and genetic diabetes, which is called neonatal diabetes.
So actually there are 4, not even 2 that we predominantly know about.
Yeah.
Right. So is there a growing trend recently that you have seen in children in recent years?
Yeah, see, basically, type 1 incidence is almost the same. It has not increased too much. Especially in India, it is lesser than the West. But type 2 diabetes is catching on because as you see that children are more sedentary. They don't play. They sit on the computer or they sit on the TV, and the eating has become more and more high carbohydrate, uh, high carbohydrate junk food. They're eating like hot dogs, like burgers, pizzas. things like that. So that is causing a high carbohydrate load, causing obesity and thereby leading to diabetes. So
that is
that type of diabetes is increasing.
that
We
is
never saw
happening
it
in
earlier. Last maybe 30 years back, we started seeing it. But now it is, if you have a patient who is obese and is diabetic, even if he's a young person, 8 years, 10 years old, you start thinking of type 2 diabetes.
with that is rare to hear that type 2 diabetes getting detected in predominantly recently in children also.
Yeah.
uh, yeah. So well, tell us, how can parents keep a check on early signs of diabetes in children, let alone be type 1 diabetes? If you can explain type 1 type 2 also.
Yeah, see, basically, uh, I told you about 4 types of diabetes, but basically, the most of them are belong to either type 1 or type 2. Type 2 is the predominant, 90% of the time it's type 2. But in children, the ratio is less. Young children, most of the time, it's type 1. It is type 25% of the time, maybe it's type 2. And MODY and genetic syndromes are very rare. So type 1 diabetes basically means that the insulin is not getting secreted at all. The zero insulin levels in the body. So they're prone to ketosis, and if you don't give them insulin, they'll die. So that is type 1 diabetes basically. Type 2 diabetes, they have a bit of insulin, residual insulin present, but either the insulin is less in amount than required, or the quality of insulin is not proper and it is not effective. So relative deficiency of insulin is there in type 2 diabetes. That is usually the type you were seeing earlier at the age of 40s, but now you're seeing it much earlier.
Right. Is the type 1 diabetes also associated with the autoimmunity?
Yeah, type 1 diabetes is basically autoimmune diabetes. In fact, the definition is that it is an autoimmune destruction of the beta cells of the pancreas. That is, the cells of the pancreas that secrete insulin. They get destroyed due to autoimmunity. Some cells of the body, basically lymphocytes, they infiltrate the beta cells and they destroy them. So it's an autoimmune origin, and these type of diabetics is seen more along with other autoimmune disorders like hypothyroidism, like celiac disease. These are the 2 other common disorders associated with type 1 diabetes.
What is the usual age bracket when we talk about type 1 diabetes in children?
It can be anywhere between after 1 year of age to about 18, 19 years of age,
Right, right, right.
usually. But there's a variety called as late onset type 1 diabetes, which occurs a bit later. And how to test it, how do you detect whether it's type 1 or type 2 is very simple. If your patient has ketones in the urine, if the patient has decrease in the C-peptide or serum insulin levels, or if the patient presents with a very violent, like with coma or with blood sugar of 500, 600, you know it's type 1.
Right, right. And
And there's some antibodies we can test, like anti-GAD antibodies, anti-islet cell antibodies. If they are positive, it's in favor of type 1 diabetes.
is there a possibility of diabetes reversal in children?
The only scenario I can think of, type 1 usually does not reverse except for a small uh, window period that comes after about 15 days to 30 days after the onset of diabetes. It's called the honeymoon period, in which time the insulin secretion returns to a bit to the normal, and the patient and the child may not require any insulin at all for 10-15 days, and then again starts requiring insulin. That is called the honeymoon period of type 1 diabetes, and that is well known. And the only other scenario I can think of is reversal of diabetes. The child is morbidly obese, has very grossly overweight, and he starts taking care of his diet and exercise and loses around 10-15 kilos. Yes, that can reverse type 2 diabetes in the child.
Right, right. Uh, can you tell us, how can parents keep a check on early signs of diabetes in children?
See, partly it is the diabetes is a inherited disease, partly. Like the type 2 has a greater genetic disposition, type 1 has lesser genetic disposition. But if your parents are diabetics, that's one indication that you have to keep a check on your children that they might be developing diabetes. So basically what you can do, there's nothing you can do to stop the onset of type 1 diabetes. But for type 2 diabetes, you can keep the weight of the child under control and make sure that his habit is not sedentary, he is active, he plays games. So, and he eats the right type of food, like all this junk food, that is available in the canteens of the schools should be avoided, like the colas, like samosas, like puris, halwa. All this should be replaced with healthy food, like vegetables and fruits.
Right, right. I think the lifestyle changes have penetrated deep within our society from younger ages to the middle age and the older
Yeah,
age.
so
We
the
are
answer
having the
is
same kind of problem.
Yeah, the answer is tackled at a younger age at the school level itself. The school should have adequate periods for games. Like out of the whole 6 or 7 hours the child goes to school, at least 1 hour should be reserved for games, and that should be compulsory. Then the canteen should be strictly monitored so that it has healthy food rather than the junk food that is usually sold. Then the the what in other countries, European countries and parts of America, cycling is encouraged. The children are encouraged to cycle to school rather than to go on an automobile or buses, right? And cycling is a way of life. And in fact, you go to California or you go to Europe, there when you ride on the local trains, there are special compartments meant for cycles. People come
Mhm.
on in a cycle, put the cycle in the train, and when they get down, then they cycle again. So uh, this sort sports has to be encouraged. Healthy eating has to be encouraged right from school age.
Right, right. We're in an age where there's nothing like too much being too much cautious. You have to be cautious at all times, starting from a younger age. Uh, tell us, Dr. Batra, how are you treating diabetes in neonatal cases?
Neonatal cases are unique. Like they can require insulin. Some of them require insulin. There's no other way you can treat them. Some of them do respond to drugs called sulfonylureas because their mechanism of the disease is like that. They have mutations in the sulfonylurea receptor, and you give them some drugs called sulfonylureas, and that overcomes the mutation and thereby produces insulin, and you can cure these children and treat them with oral drugs also.
Hmm.
So that is the way to treat neonatal diabetes, mostly insulin, and some of them respond to sulfonylureas.
Right, right.
Sulfonylureas are oral drugs.
These are oral drugs. Right. How can a child lead a healthy lifestyle in diabetes?
Child is basically dependent on the parents, right? Like whether a child leads a healthy lifestyle or not depends a lot on the parents. They have to encourage the child and they have to lead by example. Like if they go out for walks with the child, go on picnics with the child, teach them how to use a bicycle, take them swimming, take them to play football, cricket themselves, the child will develop a habit of doing all this. If they themselves are couch potatoes and sit on the bed the whole day watching TV and watching video and or spending time on the computer, child is likely to inherit the same things. So the healthy lifestyle is mainly the parents' prerogative.
Right. I think parents now it's time has come for parents to lead by example.
Yeah.
Uh, yeah. So, and also, is there a possibility of getting diabetes at birth if the mother had gestational diabetes?
No,
And
that is not known. That is not known. That disease is not transmissible at birth.
okay,
It's not a transmissible disease.
all right. And also So this is like more of a question which I think which you encounter many times. Parents usually, when they get to know about their children having diabetes at such a younger age, they kind of take it very heavy on their heart. So how do you counsel them?
We have to tell them that I tell them that this is something which God has wished on them, and like nothing they can do about it. It's not their fault. It's not the child's fault. It's just that the disease had to come, and they should be thankful that it is not a disease which is incurable like cancer or like some other diseases which are not treatable. It's a very treatable disease and it can be conquered. So first step is to put it into your mind that okay, my child has diabetes. Second is that accept it, and third, have a fight it out. Say that okay, now my child has diabetes. I'll fight it out with him and make sure that he's all right. So that is the three stages. First, the acceptance, and then the desire to fight it out. And the parents have to lead with that.
Right. Out of the type 1, type 2, the predominant diabetes, which one has a higher mortality rate?
Because type 1 occurs very early in the age group, and the mortality and the complications depend on the duration of the diabetes. So both are type 1 is probably got more complications in the uh, more complications like nephropathy, neuropathy, retinopathy, but the cardiovascular complications are much more common in type 2 diabetes.
Right, right. So they're both lethal, you're saying,
Yeah.
at their own levels.
They are lethal, like it's called a silent killer. Like most of the patients don't even know that they have got 300, 400 sugars. They walk into my OPD with 400 sugars and say, मुझे तो कुछ भी नहीं है, when you ask them to get admitted. मैं क्यों admit हो जाऊं?
Mm.
That
Yeah,
it may happen that the patient is diagnosed only when routine testing is done. You may
right,
have something wrong with them.
right. So, I mean, this is a common question, and I have to ask it. I'm sure you must answer it every day in your life. Then, what is the food that should be avoided in diabetes for children? Is it the same for children?
Children, we are much more liberal. Like don't prohibit them, let's say, occasional paratha or occasional dollop of butter or some cream or something, because they're much less likely to get coronary artery disease or heart disease.
Right,
The adults, we prohibit fatty food. But basically, both in children and adults, pure sugars are prohibited, because, or except once in a while, like the child's birthday, you can have a piece of cake, or child's special occasion, you can have a rasgulla or something. But usually pure sugars are avoided by a simple reason is that they increase the sugar much more, blood sugar much more than like say if you have 100 grams of chocolate and 100 grams of chana, the chocolate is likely to raise the sugar much more than the chana, because the glycemic index for chocolate is much higher that way.
right.
So we have avoid foods with high glycemic indexes. But occasionally, once in a while, a child, we let them eat a bit. And there are occasions in adults also where we give what is called as a food holiday. Like there's some old people who are fed up of life, depressed, not eating at all, and we have to coax them into eating half a roti or one fourth of a roti. We give them what is called as a food holiday. Food holiday means for 3-4 days they are allowed to eat whatever they want. Rasgulla, gulab jamun, tikki, anything. So for 3 days time, the appetite picks up, and then we put them back on the diabetic diet. So, and the other occasion where diabetics can eat is when they become hypoglycemic for some reason, like for becoming, example, they're taken a little more insulin, or they exercise more and they're not eaten enough, and they become hypoglycemic. When they become hypoglycemic, that's the occasion where they can eat a lot of they can eat sweets or they can eat chocolates or just to get over the hypoglycemia.
Right. Is there any symptoms that children show when type 1 when the onset of type 1 diabetes happens that
Type 1 diabetics in children is usually violent because, as I told you, there's total lack of insulin. So they present with polyuria, that is excessive urination, polydipsia, that is excessive thirst, and polyphagia, that is excessive eating. And in spite of eating more, they lose weight. They become lethargic. They have lack of energy. They become weak. Uh, so that's these are the signs that type 1 diabetes may be developing, or they have developed an infection which does not heal, or they may suddenly come into coma.
mm, right, right. And can diabetes and lung related issues such as asthma be a complication at a later stage for children?
Well, it's the opposite way around. Let's say the child with diabetes has asthma. If he needs to be given drugs like steroids, it becomes a problem because they add to the diabetes. And in fact, in other respiratory diseases, usually the intensity is prolonged when diabetes, when they occur in diabetics, and they don't easily get cured. As let's say, if a respiratory disease develops in a non-diabetic, it's much more likely that he gets it or gets over it in 4 5 days or 6 days, whereas in a diabetic it might take 10 days.
Right, right. And also, are there any myths that you can bust relating to diabetes as well as their treatment in children?
I didn't get your question.
Are there any myths also when it comes to diabetes and
Yeah,
its
a
treatment
myth
in
is
children?
like one common myth is good is all right. Don't eat sugar, but good is all right.
Yeah,
That's
this
not
is
all
very
right. If they
prevalent
say,
one.
then they say that once you start insulin, always be on insulin. That's not true because many adults we put on insulin when they are sick, when they have infection, when they are pregnant, when they have myocardial infarction, when they have other diseases. For a short time, for 10 15 days, we put them on insulin and we put them back on oral drugs as soon as they get better. So it's not true that once on insulin is always on insulin. So these are two common myths.
Right,
Other myths, these are two common ones I can think of.
right, right. Dr. Batra, do you have a message for World Diabetes Day? This is my last question for you.
Yeah, if you want to tackle diabetes, especially type 2 diabetes, you have to tackle it at a very young age. Like if you let the children become obese, they're likely to have a much more chance of becoming diabetic when they become adults. And as you can see, what is happening is that even at the age of 10 to 12, they're developing diabetes. So, as I said, it has to be at the school level, the canteen level, the sports period level, that should have a compulsory sports period for 1 hour at least a day. The canteen should have healthy food rather than junk food. The the children should be made taught more that they should cycle to school rather than go on buses or go on automobiles or scooters. They should exercise more and have a more healthy lifestyle. That's
Right,
the only way you can tackle the epidemic. Otherwise, it will grow.
right, right. And don't panic if it is type 1 diabetes. Consult the doctor and take the whole treatment
Yeah,
until.
diabetes is a curable disease. It's not an incurable disease. That is the message that should go. And if we treat it rightly, a diabetic can live as much as a healthy life as a non-diabetic.
Yeah.
I'm 68 years old and I've been diabetic for 15 years. So I'm living all right. See,
On that note, thanks a lot, Dr. Batra, for joining us here and giving us deep insights into diabetes in children and type 2 diabetes in general in adults as well. Thanks a lot for Dr. Batra for joining us here.
thank you.
Moving forward towards pregnancy and diabetes. And to tell us all the aspects of their correlations and what effects can diabetes have on a pregnant woman, we have with us Dr. Garima Sawhney, gynecologist and co-founder Pristine Care.
Our endeavor this year is to discuss about how diabetes touches aspects of life in different ways. One of the ways that women get affected with diabetes is when they are expecting to get pregnant or during their pregnancy. To understand what are the challenges that a diabetic woman could face when she gets pregnant or when she is looking to get pregnant, gestational diabetes, how it affects her, and what is the effect of this diabetes on the long term and also on the newborn. To discuss all this, we have with us Dr. Garima Sawhney, who's a gynecologist and is also the co-founder of Pristine Healthcare. So welcome, Dr. Garima, to BW Healthcare World. My first question to you is that though the disease or the challenge of diabetes remains the same, the symptoms may be different for men or women. I don't know if that's the case. What are some of the symptoms that women experience in diabetes, and are there some early signs that they should be looking out for?
See, most of these symptoms remain same, but yes, females comes with lesser immunity and all. So the very early signs, whether it's male or female, I would say the signs or symptoms are usually like there is hunger for thirst, number one. Second, there is increased frequency of urination which happens. Then people notice, like who are into their pre-diabetic stage, that if they get any kind of injury, the wound healing takes time. There can be some kind of skin infections very recurrently happening to them. And there is color discoloration, like on the neck, on the elbows. That kind of thing is also like noted in patients who are pre-diabetic. If we talk specifically about females comes up with little different symptoms like UTI. UTI is very, very common with patients who are having diabetes, right? Because of small urethra in females, so they are very prone to catch up infection soon. Similarly, vaginal infections, especially like candid infections, that is fungal infection, yeast infection is something which is super common in patients who are having diabetes. And when we say fungal infection, it always takes a lot of time to get cured. And with diabetes, it becomes really difficult to cure it. When there is a diabetes, there is some hormonal changes also expected. So many females also complains about vaginal dryness, right? We have also noticed that patients with diabetes, they are mostly obese. And because there is a vicious circle which starts forming in the body, which can even lead to diseases like PCOS. So these are kind of unique things which are like mostly seen in females, not in males. But I think any of it, we need to prevent it.
Right. So, Dr. Garima, if a woman has pre-gestational diabetes, is it difficult for that woman to conceive?
See, I won't say in this era where so much of medical advancements has happened, there is any female in this world who can't conceive, right? So I don't think that giving this statement that that a patient with pre-diabetes or diabetes cannot conceive. They can definitely conceive, but what they can face with some issues, right? Now, as I said, pre-diabetic patient or diabetic patients are usually obese, and because there are hormonal changes happening because of obesity and diabetes. So because of that, maybe the ovulation cycle is something which is not taking place, and because of which they are facing problems in conception, right? Next, what we have seen, because of hormonal imbalance, the implantation which has to happen, right, after fertilization, it also gets hampered. So these are the two things. And third, I would say, not like facing problems in conceiving, but once a female has conceived, there are chances, because diabetes is there, if it is not controlled, then the patient might land up into situations like abortions.
Okay. Like you said, and this is actually one of the misconceptions, that a woman who has diabetes finds it difficult or will not be able to conceive. Are there any other misconceptions relating to diabetes that are believed to be true by women who are trying to be pregnant or conceive?
Yeah, you said like the very first thing that they cannot conceive, or there is a misconception that she will abort if she conceives, right? But or there is a misconception that the baby will not come out to be normal. There will be abnormalities to the patients who have got diabetes, or there is a misconception that if she has got diabetes, she is bound to deliver early and her baby will have to go to the nursery for a few months or few days, right? I would say that these are the possibilities, these things can happen, but if the doctor is taking care of the patient very well, and if the patient is taking care of herself very well, and if the diabetes is under control, I don't think any of these situations are being faced.
Got it. So Dr. Garima, one is when there is a diabetic woman who's looking at becoming pregnant or conceiving. But I've also believed that there are conditions when a woman is pregnant, she develops diabetes during pregnancy. Can you tell us a little bit more about that?
So when a woman develops diabetes during pregnancy, the terminology is called as gestational diabetes. And when we say gestational diabetes, it is something wherein a female develops diabetes during pregnancy, post 20 weeks of pregnancy. Okay, so this is a very common thing during pregnancy, and this can happen to a female who was non-diabetic even before pregnancy. So during pregnancy, what happens, there comes like insulin resistance, because the body is gaining weight, right? And the carbohydrates need is also has increased. The cells needs more of insulin, and what happens is that the cells are not able to means there exists insulin resistance at that stage, and so the proper insulin action is not taking place, because of which the sugar levels are going up. And usually what we see is this kind of condition can come up in a pregnant female around 24 weeks or above, right? So it is nothing like, if you are not diabetic, it doesn't mean that a patient cannot have diabetes during pregnancy. She can develop.
Okay. But this diabetes that is developed during pregnancy, or the gestational diabetes, can this be reversed, or does this get reversed on its own?
So if you talk specifically about pregnancy, right, what we can say is, we can't say that a pregnant lady, once she had got diabetes during pregnancy, one day she takes medicine and next day she doesn't need medicine, or one day she does the control with the food habits and lifestyle, the next day she doesn't need to do that. So once the pregnancy has been diagnosed with diabetes, the patient needs to be treated like a diabetic patient throughout pregnancy. But post pregnancy, for those ladies who have developed diabetes during pregnancy, that is gestational diabetes, it is mostly, in most of the cases, we have seen that those females become diabetic free immediately after delivery, right? So those patients who deliver immediately, they become diabetic free, but we need to observe them, we need to monitor them, and specifically for 6 weeks, after 6 weeks we do the blood test and other tests to know whether the diabetes still persists or not. And most of the females, 90% of females, don't have diabetes post that.
But tell me one thing, Dr. Garima, that women who develop this condition of being diabetic during pregnancy, is it a sign of them being pre-diabetic anyways, and somewhere later in their life they will become diabetic, or they are prone to becoming diabetic?
So what happens, the studies tells us that those patients who develop diabetes during pregnancy are at risk of developing type 2 diabetes post 40 years or after 20 years of their pregnancy. Okay, so those ladies who have conceived at an age of maybe 20, 25, they are at a risk of developing type 2 diabetes when they reach the age of 40 plus. Okay, so definitely if you have developed diabetes during pregnancy, you are at risk, but it doesn't mean that you can't cure it, right? So patients who develop these kind of things, they need to undergo monitoring. As I said, post 6 weeks, that is 1.5 months of delivery, one has to undergo a test. Second, it is always advised that those females who got diabetes during pregnancy should undergo screening for diabetes every 1 or 3 years. So they should go for their checkups with the doctors every 1 year and get themselves checked for diabetes so that they can prevent it.
Got it. Now, the another condition that comes in is that if a woman has become diabetic during her pregnancy, does this mean that she is likely to develop diabetes in her next pregnancy as well?
So when we see into those patients like who are at risk of developing gestational diabetes, we say those patients who have who are pre-diabetic or whose there is a family history, first generation relatives are having diabetes, they are at risk. The patients who are obese are having risk of developing gestational diabetes. Patients of Asian community are having risk of developing diabetes. And so those patients who had previous history of having diabetes during pregnancy are at very risk of having diabetes in their second pregnancy also. Or those patients who even had no diabetes, but they had like a baby weight, a delivery in the past, like a baby of maybe 4 kg, they are also at the risk of developing diabetes in their second pregnancy.
So, Dr. Garima, one is that a person is diabetic. Second is you're diabetic and you're pregnant. Are there any risks which are associated with diabetes for a pregnant women that they need to be really careful of?
So every patient needs to be careful, I would say, whether diabetic, non-diabetic. But yes, you need to be extra careful if you are either diabetic or you develop diabetes during pregnancy. And I would say when we say gestational diabetes, or a patient who has got diabetes in the past, there are 3 set of patients we divide into. One, the first class of patients, that is those who only need kind of lifestyle changes or food habits needs to get changed. Second, I would say, are those patients who need medicines, right? Third, there are patients who even cannot control diabetes with medicines like oral medications and all, and they need insulin, right? So so whatever your case is, like whatever the patient is in, whatever stage it is, and whatever is the requirement, whether it's the lifestyle thing or it's the food habit change, or is it the need of the oral medications, or is it the need of the insulin, one has to continue during pregnancy. Otherwise they can get other complications, like first grade can get into the second can get into the third, and third can have complications related to pregnancy.
Now, when a woman is diabetic or has developed gestational diabetes during pregnancy, does it risk the baby developing the type 1 diabetes?
See, if I don't talk about type 1, if I say type 2, or if I talk about gestational diabetes, I would say those babies who are born with mothers who had either type 1, type 2, or gestational diabetes are already at risk of having some kind of congenital anomalies, or you can say they can be overweight, because of which they can develop later on in early days, they can develop low sugar levels. But it's rarely seen that the patients who develop gestational diabetes or who had type 2 diabetes, their babies will have type 1 diabetes. It's not there. But those females or the parents who has this history of type 1 diabetes, their babies are at risk of developing type 1 diabetes. Like 1 in 17, I can say, is the risk for a baby to develop diabetes till the age of 22.
Dr. Garima, one more thing that comes into my mind is that, a woman who develops gestational diabetes or is diabetic anyways, will be taking some medicines, usually a metformin or some kind of a medicine that she would be taking. Now, what happens when she is lactating, when she is breastfeeding her child? What are the complications for the child, and what does she need to do at that point in time?
I would say that she has to continue what she is doing. Metformin, I don't think, is an indication for not to breastfeed, right? She can continue breastfeeding with it, and means if diabetic female, if they are breastfeeding, I don't think they are transferring diabetes to their kids. Okay, they can continue doing it, but for their own recovery, because they have undergone deliveries and they might have undergone C-sections. For them, it is very, very important that they control diabetes, because then they can develop infections in their wound, like the C-section, or if they had a normal delivery, there is that kind of a risk. So she has to continue taking metformin or whatever drugs would continue during pregnancy for at least 1.5 months after delivery.
So would she not be required to change her medication during that time to?
Mostly we don't means discontinue the medications which were started, right? So we continue the things like whatever was there. So for 1.5 months we don't discontinue, but yes, once as I said, it's a reversible thing. So once like it is cured, everything gets stopped.
Got it.
Or immediately, like, so it depends. If a patient has developed gestational diabetes, we can stop, like after 2-3 days of monitoring, we can stop. But if a patient was pre-diabetic, then everything needs to be continued. And after monitoring for 1.5 months, those things can get stopped.
Dr. Lavaya, are there any conditions that can be developed over a long-term period post-pregnancy if a woman develops gestational diabetes? I mean, she has not been diabetic earlier, but suddenly she becomes diabetic. What are the long-term effects of that?
I would say one major one, that is obesity. And obesity is something which comes with a lot of other diseases in itself, right? So a patient who developed diabetes during pregnancy, or like who was pre-diabetic but was not aware about it, she definitely has a risk of developing diabetes, but more than that, she's at a risk of developing obesity. And obesity itself comes with a lot of other problems, like hypertension, like cardiovascular diseases, like she can even develop polycystic ovaries, right? She can have complications because of all these things, like in conception, right? All these things can come in like future days for her. And immediate, if I have to tell that what can be the immediate complications, as I said, that wound healing will be a major issue. Like she will have difficulty in healing of the scar of or episiotomy or C-sections. So these are basically the more common complications with the patients who have got diabetes.
So in your opinion, how does a woman take care of her health during pregnancy or post-pregnancy after she has developed diabetes? Because during pregnancy, she may not be able to exercise the way she needs to, and she's also, taking certain foods for the baby's health. So, it could be contradictory to what a diabetic patient needs to do. So how does a woman take care of herself?
So it's during pregnancy, it's very important to follow what your doctor is telling you, right? So as far as taking care of diabetes, which becomes very, very important, she has to follow whatever advice, like medications or insulin has been prescribed to her. She has to continue taking that. The next very thing which I tell to most of my patients are that take a help of a dietitian who can help you in telling you what needs to be eaten. And mostly what we say, it should be less carbohydrate diet. Okay, it can be rich in protein, right? It can be a little bit high on fat, but carbs needs to get down. So taking help from a dietitian would really help them. Means getting onto complex carbohydrate diet is something which most of the dietitians also advise. Second thing, I understand they cannot do a lot of physical activities, but there are certain activities which they can definitely do, like at least half an hour of walk, right? They can do, like they can do 10 minutes walk. If they cannot do at a stretch of 30 minutes, they can do it 10 minutes morning, 10 minutes afternoon, 10 minutes in the evening, or 15 minutes morning, 15 minutes evening. Or they can even practice certain yoga asanas, right? There are yoga experts now. I've seen many patients going online and taking prenatal yoga sessions and prenatal exercises. They should definitely do it. And if nothing, walk is something which every patient, whether they are, every pregnant female should at least do half an hour of walk.
Got it. You brought up a very important issue, and which I'm very intrigued to ask you. How does one choose the right dietitian, nutritionist? There are so many people who are self-claimed dietitians, self-claimed nutritionists. How does somebody, and they're very popular. I mean, you have millions, some of these people have millions of followers on Instagram, etc. How do you choose the right nutritionist when you're pregnant?
I would say your doctor can recommend you the best one, but yes, now with the internet in the system, right? Everyone is on internet. You can go and check on the reviews. You can take feedback from people like who have already taken diet from one particular person, right? But I would say when I talk about dietitian, I don't say that you have to go on to any kind of a crash course or something. So choose a dietitian who is helping you continue what you do daily, right? It the dietitian should not be someone that आज मैं ये सब खा रहा हूँ, कल सब बंद, right? The dietitian should be someone that who should help you continue what you love to eat. Otherwise, you will have a dietitian for you. You will take on diets for like months with that person, and after that you will start craving for whatever you love, and you will get back to the things which you used to love, and whatever result you have got, it will all fail. So talk to a lot of them, see who's synchronizing with your needs, just choose that.
Got it. Dr. Garima, before I let you go, what's your message to the pregnant women or women who have diabetes looking to become pregnant on the World Diabetes Day? I mean, is it something to worry, or it's important to manage it? What would be your suggestion to the women today?
So if you are pregnant, don't think that you will there is 100% chance that you will have diabetes. But yes, I would say as a doctor that there is a chance. So you should control your sugar from very beginning. Keep monitoring. I think universally now the doctors advise you to check your sugar levels at the very start of your pregnancy and at around 24 weeks. Don't miss that test, even if you are not having any high risk of having diabetes during pregnancy. Second, for those females who have developed diabetes during pregnancy, I would say just stick to the healthy routine, follow your doctor, and don't worry about it, because stress leads to more uncontrolled sugar levels. So cut down your stress. Just think positive about your pregnancy. Think about like what is next after 9 months, and follow your doctor. Let your doctor decide what is best for you. Only thing is just obey what they are saying. Your compliance should not be something which you should think of leaving at this stage of 9 months. So don't worry, don't take stress, just chill.
How many women in your experience develop gestational diabetes during pregnancy?
So I would say out of 10, at least 3 will come with gestational diabetes. And it's the lifestyle thing, because even though we control everything during pregnancy, but they are prone, as I said, Asian community is something which is prone. Most of the female comes with the family history of having diabetes. Most of them, I would say, are overweight. So they are already at risk of having diabetes. So 3 out of 10 develops.
3 out of 10 is quite a number.
So it's a number in metro city, I can say, not about rural India.
So 3 out of 10 women in metropolitan cities during pregnancy are bound to develop gestational diabetes. And you mentioned Asians anyways are prone to diabetes more than other races. So I think, what I'm understanding out of this conversation is that, even if you get diabetes, there's nothing to worry. You can lead a life, but you need to have a little control over yourself, be under the care of a good doctor, and ensure that you do not, you're mitigating the risks associated to diabetes in a longer span.
Correct.
Right?
Correct.
So, Dr. Garima Sahni, it is such a pleasure to have spoken with you and bring all this information to our viewers. Thank you so much for taking our time to be with us on BW Healthcare World. Thank you.
Thank you. Thank you.
Believe it or not, diabetes also penetrates the nerves and arteries in the brain, creating different complications. Now, to tell us how our brain functions and diabetes are related, we have with us Dr. Praveen Gupta, Director and HOD, Fortis Memorial Research Institute, Gurugram. Welcome, Dr. Gupta. Thank you for joining us.
Thank you, Shivam, for having me over.
Dr. Gupta, when we talk about diabetes, we factor in the risk factors such as cardiovascular risk factors, heart attacks. We factor in, kidney failures and whatnot. But a very less highlighted part of diabetes is the neuro aspect of it, the brain disorder aspect of it. Now, can you tell us how is our brain function related to diabetes?
See, diabetes is a metabolic disorder of far-reaching multiple consequences. So, by increasing the blood sugar and affecting the cholesterol metabolism, diabetes causes degeneration of arteries that take blood to the brain. Also, parallelly, diabetes causes degeneration of the nerves by depositing the blood sugar in the nerve membrane. So this way, diabetes leads to cellular dysfunction by multiple mechanisms. So, diabetes thus has far-reaching consequences on brain function. And also by damaging the brain slowly, it can actually become a risk factor for dementia also, sir.
Right. So it damages the nerves as well and as well as the cells as well.
Yeah, it damages the brain, it damages the arteries to brain, it damages the nerve and damages the cells, sir.
Right. So what are the brain disorders which can be triggered due to diabetes?
Uh, the the most sinister brain disorder of public importance is stroke. Diabetes is a number one risk factor for stroke by causing deposition of cholesterol on brain arteries. It narrows the arteries to the brain, which leads to clotting or hemorrhage in the brain, both, which causes paralysis, loss of speech, loss of memory, loss of vision, and is a significant cause of morbidity and mortality in our population. Second, by causing subtle damages to the brain, diabetes can become a risk factor for dementia also. Third, diabetes by getting depositing of sugar into the nerves damages the nerves, giving rise to neuropathy, which is painful nerve dysfunction, paresthesias, loss of sensation, and weakness in nerves. So this way, diabetes has far-reaching consequences on the brain and the body.
Right. So there is a golden hour factor when it comes
Yeah.
to heart attacks, right? Is there any is there a factor or is there a golden hour kind of concept, or what is the necessary things in respect to a brain stroke?
You have asked a very relevant and pertinent question. Brain strokes are reversible by giving an injection called thrombolytic within 4.5 hours of onset. So which means within 4.5 hours of onset, if we are able to diagnose a ischemic brain stroke because of clotting, by giving an injection called a thrombolytic, we can reverse it.
Right.
In certain patients where a large artery to brain is blocked, they can reverse the stroke up to 24 hours, which means that golden period in stroke can range from 4.5 hours to 24 hours. But unlike a heart attack, which can only be caused by clotting in the heart vessels, strokes can be caused both by clotting and hemorrhage.
Right.
Because of which it is pertinent to be able to do a CT scan or MRI to diagnose the stroke as either ischemic or hemorrhagic before initiating the above treatment.
Right.
So I implore that anybody who has suspicion of stroke symptoms, the commonest among them are facial drooping to one side, slurring of speech, weakness in arms or legs, sudden imbalance or walking difficulty, sudden swallowing difficulty, to reach a stroke ready hospital immediately where they can be diagnosed and treated in time, saving both morbidity and mortality.
Right. Right. You described the symptoms also when it comes to that period. So between ischemic strokes and hemorrhages, is there a difference in respect to a diagnosis or the window of that injection that you talked about?
So hemorrhages are not treated by injections because there the blood is leaked. And
Mhm.
ischemic stroke are treated by blood thinning injections.
Okay.
By trying to differentiate them clinically, hemorrhagic strokes are more likely to be associated with unconsciousness
Mm-hmm.
and very high blood pressure and headache and vomiting at onset. On the contrary, ischemic strokes, the consciousness is usually preserved. The blood pressure may be high but not very high and are not usually accompanied by headache and vomiting. So that is a small ballpark difference between the two, though there can be significant overlap between the both.
Right. Right. So there is a significant amount of evidence we have nowadays that diabetes, furthers the chances of getting a brain stroke within a few
Absolutely.
percent.
We have very robust evidence that diabetes is among the commonest and most prominent stroke risk factors.
Right. Right. Uh, so are people with diabetes also more prone to get depression and anxiety? Because I was reading about it and I saw some studies which dwelled into depression and anxiety when it comes to diabetic people, and they were more inclined to get depression and anxiety.
So diabetes is a multifactorial disorder which affects the body in numerous ways. It causes pain, it causes weakness, it causes limitation of lifestyle, limitation of diet, bodily dysfunction, brain dysfunction, all of which are risk factors for depression and anxiety. So a person whose diet is restricted, who has to take many medicines, whose body is exposed to multiple metabolic disorders, all by itself automatically becomes a victim of depression and anxiety.
Right. You also talked about Alzheimer's, there, dementia being a very big risk factor to diabetes and brain disorders. How does that onset happens?
See, diabetes causes small or large damages to the brain in the form of small subclinical, means silent strokes and visible strokes. These strokes damage the brain substance. So when you age and your brain becomes atrophic with age, the already damaged brain becomes more prone to cognitive decline and loss of memory. That is how diabetes becomes a very important risk factor for vascular dementia and Alzheimer's disease also.
Right, right. So, what is the sign or a symptom to look out for diabetic late brain disorders? Are there any, signs that one can pick for dementia, for example, or for the other risk factors when it comes to depression, anxiety?
Yeah. So we'll divide them into disease wise.
Yeah.
So for stroke, the major risk factor is sudden slurring of speech, facial deviation to one side, weakness in arms and legs, or sudden loss of sensation, sudden loss of memory or change in behavior, or sudden loss of vision, imbalance, difficulty in swallowing. For dementia, there is gradually progressive loss of memory, understanding, orientation to time, dates, people, inability to remember names or recent happenings, which are sufficient enough to impact your social life or daily life. For depression Depression and anxiety, feeling low, dull, not feeling interested in your daily activities, or unusually feeling restless, having ghabrat at all times, not desirous of doing things, eating are symptoms of depression and anxiety. Plus weakness in legs, numbness in legs, pain in the legs in night are symptoms of diabetic neuropathy on which how the diabetes affects the nerves.
Right. You talked about a very prominent, risk factor of diabetes, which is the leg and the pain in the leg. Tell us more about that. What happens to the nerves and the area of below our waist when it comes to diabetes? What are the risk factors associated there?
So diabetes causes two problems. Diabetes causes deposition of abnormal metabolic products in the nerve membranes, which destroys the nerve function. Diabetes impairs the transport through nerves, which leads to abnormal nutrition in the nerves. And
Mhm.
since the nerves to the legs are the longest, they suffer more. So the diabetic nerve problems start with the foot and they gradually ascend up the leg. Like the brain, diabetes also causes damage to the arteries that
Mhm.
take blood to the legs, which leads to ischemic damage to legs. All
Right.
of this lack of sensation and lack of blood supply can give rise to a abnormal foot condition with non-healing ulcers in the foot called diabetic foot.
Right.
Diabetic neuropathy is very painful and disturbs the patient's sleep in night. Diabetic nerve involvement can affect the arms, it can affect the eyes, it can affect the face, and it can affect the body also. So
Right.
diabetic neuropathy has far-reaching consequences on human body.
So it's not just the legs.
It affects the legs predominantly in most people, but it has far-reaching consequences.
Right. So, what are the therapies or treatments that are currently available to treat neurodegenerative disorders that occur due to diabetes?
Sir, the first and the foremost treatment for diabetic related neural complications is control of blood sugar.
Mm-hmm.
If you control your blood sugar well and keep your HbA1c down, which is 3-month estimate of blood sugar, the deposition of sugar and sugar related metabolites in the arteries and nerves is less, which helps to prevent the diabetic complications. Second is a diet which is low in carbohydrate and fat, which leads to less cholesterol generation. And as we have discussed, cholesterol is a major cause of arterial damage in diabetic patients.
Mm-hmm.
Third is exercise. If we do daily exercise, it improves the body metabolism at large, which gives rise to less cholesterol, less hypertension, salvaging our arteries and nerves. Fourth is control of blood pressure. If we take a diet low in salt and control our blood pressure, the impact on our kidneys, our arteries, our heart is minimized, protecting our brain and the nerves.
Right.
Fourth is a diet rich in fruits, in vegetables, because they contain antioxidants, which protect our nerves and the brain.
Mm-hmm.
Then next is taking adequate B12, because B12 is a very important vitamin for nerves and the brain. Then controlling addictions like excessive alcohol and smoking, because they are primary risk factors for brain and nerve dysfunction. Plus, managing your diabetes or other complications and taking regular medicines like blood thinners, which are important to help prevent various complications related to diabetes.
Right. Right. Basically, you want, yeah, if you want to get these brain disorders down that come associated with diabetes, you just have to control and focus on controlling your diabetes first, and rest will eventually
Right,
fall in
right.
place.
Absolutely, sir. If you
Right.
control your diabetes first and do simple things like 30 minutes of daily exercise, like walking for 150 minutes a week, eating less fat, reducing salt in diet, you can cut down your stroke risk by 50% by these simple measures.
Right. Right. So, okay, you've already described do's and don'ts for people having diabetes to keep their, but also if a person is, suffering from these disorders, let's say Alzheimer's, or and it's not able to control his sugar for that amount of period. And so what are the do's and don'ts for those people who are suffering from these disorders to keep their brain functions intact? Are there some brain exercises that you advise?
So, one of the best exercises is walking. If you have stroke, if you are at risk for dementia, 30 minutes of walk every day prevents the risk of stroke and dementia both. Second, doing puzzles like Sudoku, doing intellectually stimulating activities, socialization, interacting with people, keeping your mind sharp preserves the brain function. Third is adequate nutrition. If you have a diet rich in antioxidants, fiber, that keeps your cholesterol down, that prevents oxidative damage to your brain, then preventing addictions like smoking and alcohol, because your brain is already affected by diabetes and these addictions are causing ongoing brain damage. So if you can stop all that and avoiding stress and anxiety,
Mm-hmm.
if you change your perspective or viewpoint to life and align it to your current situation, you can prevent excessive stress and strain on your brain, salvaging and preserving it for better functions.
Right, right. Uh, this is my second last question to you. Do anti-diabetic drugs assist in cognitive regeneration? See, there are studies which have come which are telling now that anti-diabetic drugs can also be a possible, drug to cognitive regeneration. What's your
See,
viewpoint on that?
there are some new drugs in diabetes which are coming up, which reverse the diabetes related metabolic dysfunction. They
Mm-hmm.
just do not control blood sugar. So, if we are able to create more such drugs, we will be able to reduce the impact of diabetes on the nerve membrane or the arteries. So, it is possible that eventually they will lead to protection of brain. Though they do not reverse cognitive dysfunction, but they may be protective towards brain in the long run.
They do not reverse
The
the
cognitive,
regenerate. They don't reverse. Basically, they don't regenerate the cognitive function.
yeah, yeah,
They
absolutely.
they protect it.
They protect it.
Right. So this is my last question to you, Dr. Gupta. What is your message that you want to give out on World Diabetes Day?
See, India is the diabetes capital of the world. Approximately 15% of urban middle-aged Indian males are diabetics, which means for our country, diabetes is the public health enemy number one. With proper diet, exercise, and doing regular checks, say 6 monthly or yearly on your blood sugar, it is able, it is possible to prevent diabetes or to diagnose and treat it appropriately in time. Do not be complacent and say, kya farak padta hai, what will happen to me, I am so healthy. Because the impact of diabetes is later onset. At diagnosis, you may not have any impact, but 5-10 years when the impact happens, you may not be able to reverse it. Simple medication, easy lifestyle changes can actually decrease diabetic related complications by 50%. So please do not be ignorant. Don't delude yourself. Go ahead, prevent and treat your diabetes well to have a healthy and happy life.
Right, right. Thank you. Thanks a lot, Dr. Praveen
Thank you,
Gupta,
Shivam.
for joining us here. It was lovely speaking with you.
Same here. Pleasure, Shivam. And thank you for creating this educative interview around a very important public health problem.
Thank you. Thanks a lot, sir.
Thank
Thank
you,
you.
sir. Thank you.
Another risk factor for diabetes is eye disorders. And to tell us how can we be wary of any risk factors related to our eyesight, we have with us Dr. Arun Singhvi, Chairman and Managing Director, ASG Hospital Private Limited.
One another part of our body that gets affected when we have diabetes is our eyes. To discuss what we need to do and how to take care of our eyes if we are diabetic, we have with us Dr. Arun Singhvi, who is a leading ophthalmic surgeon specializing in cataract, cornea, and refractive procedures. He is the co-founder, chairman, and managing director of ASG Hospitals, which is today boasts of a geographically diversified presence with 45 plus specialized eye care hospitals across 38 cities in India and 2 international locations, Uganda and Nepal. Welcome to BW Healthcare World on the World Diabetes Day, Dr. Singhvi. So Dr. Singhvi, welcome to BW Healthcare World. My first question to you is that India is known as the diabetes capital of the world. Does that also mean that we are poised to be the capital for diabetic retinopathy? How big do you think is the challenge that we are facing as a nation?
Thanks, Arvinder, for inviting. And yeah, as you said, India is definitely the diabetic capital of the world. And as the things are going and what we see over past 15 years of my career in ophthalmology, what we have seen is there are more youngsters who are getting diabetes these days. That's very alarming, which is showing a steep rise in diabetic cases. And similarly, because of lack of awareness, particularly in countries like India, third world countries, where until something, I would say, gross decrease in vision happens, people are not concerned about it. So till that happens, we've almost lost the vision, or I can say only part of the vision would recover. So that's why diabetic retinopathy challenge definitely will be more in India compared to Western world, or say compared to the other developed countries. And having said that, see, one is how do you neglect the thing? Second is your lifestyle. Third is your, I would say, the negligence towards getting screened, illiteracy, part of it. It's no more a disease of urban world now, you can say. It's also present and rampantly present and more neglected in semi-urban and rural areas also. That's where the whole challenge lies.
So I think, what I hear you is that people are in denial. They do not go in for screening, despite knowing that, this is one of the challenges that as a diabetic one could face, right? So Dr. Singhvi, are there different types of diabetic retinopathies? Can you explain what are these?
So diabetic retinopathy, I would say, yes, there are, but it's a progressive retinopathy. So it will start with a very early stage diabetic retinopathy, then would progress to a non-proliferative diabetic retinopathy. When it is further neglected or untreated, can result into some macular edemas coming in, and then finally can turn into a progressive or a proliferative diabetic retinopathy and a very high risk stage where there is a bleeding and then there is a vitreous hemorrhage and then you have to treat them surgically. So these are all spectrum of this disease, more so common in insulin dependent diabetic mellitus than a non-insulin dependent, which is a late stage disease. But I would say the paradox is you see more patients of the non-insulin dependent diabetes mellitus while they would have less of this disease because they neglect the disease maximum. By the time they come to know about decrease in vision, they would have had diabetes for past 5, 7, 10 years. That's where the whole spectrum of challenge lies, how to screen them fast, how to repeatedly screen them every year. And see, Harvinder, one thing we have to realize, eyes is the only organ where you can see what's happening by technology. You have cameras which can directly visualize into your eyes. So treating diabetic retinopathy is not bigger challenge. But once you have had such a florid diabetic retinopathy that, I mean, doctors can't help it but to lose your vision or field of vision, and we can retain or maintain whatever you have. And second part to it is, even if we have treated, we have, so what happens in these are all microangiopathies. Diabetes per se causes leaky vessels everywhere in body, including eyes. You will have nephropathy, you will have retinopathy, you will have angiopathy, you will have neuropathy, you will have hypertension, dyslipidemia, anemia. It's a wholesome, it's a wholesome body impact which comes with diabetes, a negative impact. And these all increase the retinopathy chances. And while you go to a diabetologist, and has he not screened your eyes or has he not referred to an ophthalmologist, by the time you come to us, we have lost almost half the battle.
So, let me ask you this question. What, because as a diabetic, you're normally, I mean, unless you're somebody who's a unique case where people have got diabetes at a very early age, but usually it is in their 40s and 50s.
Yes.
Now, by the time they realize that their vision is going back, the first thing that comes into their mind is not because of diabetes, umar ke saath aise hota hai, So, what is it that is a sign that it could be a diabetic related eye problem and not just a vision going bad because of age?
So per se, patients wouldn't know it, first of all. So the best thing is, whenever you get first sign of increased blood sugar, get your eyes screened so that the doctor can tell you whether there is a development of a cataract or there is a development of glaucoma, which coexist with diabetes and sometimes progresses faster with diabetes, or it is diabetic retinopathy, or it is even a refractive change, because sometimes fluctuation in sugars might give you a change of power of your glasses also. So there can be multiple reasons, but as soon as you know you have diabetes, at least then contact the ophthalmologist at least once.
Got it. Got it. Now, there are two types of diabetes. One is type 1 and type 2. And type 1 is typically when people are born with diabetes. So these are kids. Do they also face the same problem of eyes, or is type 2 diabetes more prone to give you an eye problem?
No. So they definitely face more problems. They definitely have severe problems, more grave than what a non-insulin dependent, which we call type 2 diabetes have. Type 1 has worse prognosis, but their numbers are less. This is less prevalent. So at least, the gravity of them is they at least know from day one that they have it. So we can protect them early, because it's an insulin dependent diabetes. They would have more gravity of awareness and repeated follow-up with doctors. So we can prevent their vision for a very, very long period. With NPDR or the non-insulin dependent diabetes type 2, the neglect is the main cause of 2 to 5 years, which causes the damage till they come to an ophthalmologist.
So Dr. Singhvi, this brings me to another point that usually the diabetic would not be knowing that he's diabetic in the early stage, the pre-diabetic stage and all. So one is, when you are diabetic, you go to a eye doctor, but could it be the other way around, that if you are finding a vision problem, this could be a sign of diabetes?
It could be a sign of diabetes. We have seen multiple of patients, and we see regularly multiple patients who have first sign. As I said, it's not necessarily a retinopathy. You might have change of power of your glasses even with diabetes, because what happens in diabetes is your intraocular lens absorbs a lot of sugar. So their refractive index changes, and which causes a change in the power of your glasses. So these all can be an early sign to show that yes, there can be a diabetic predisposition to it. Whenever a person has had a family history of diabetes, those all people, even not having diabetes, should get screened for blood sugars and ophthalmology checkup at a regular period, even while they don't develop diabetes or may develop in future. That's a regular thing which they have to do. Diabetes is very, very underwritten in India. It is a very, very dangerous disease for your body per se, leave apart eyes. The immunity, we saw in pandemic, what happened, the diabetics had a very, very high fatality rate because their immune systems are bad. Their fighting spirit of the body goes down. So that's most important. And whatever will I tell you today, the lasers can be done, etc. can be done. The best thing you can do is have a healthy diet, run, physical activity. That's the best part the body does about preventing the side effects or the complications of diabetes.
Sir, what are some of the common tests that are done in case of a problem among diabetes? And this is specific to eyes.
Yeah. So, see, one is basic, we would start with get your blood tested, particularly HbA1c, because these diabetic patients, usually when they come to doctor, they do fasting and get their immediate sugar control. So when the doctor sees, he feels, they are fasting well, they are taking care of their body well, but it is not so. They've just fasted for the previous night or the morning they came to, and their blood sugar is controlled. So have a long-term blood sugar control check for 3 months. That's a normal these days. Get their lipid profile checked, because dyslipidemia and hemoglobin changes along with diabetes is a poor prognostic sign. These are 3 tests I would rate which are very important for systemic checkup. And then comes to the eyes. We have very, very good clinical examination system nowadays, where we see with the 90D, the non-magnetic fundus camera, the OCTs, the angiographies, all these tests, even the field tests sometimes when we do post lasers. These are the tests which are required. I won't say they're required on day one. Yes, there can be a basic investigation done to have it as a base record over which we can build on in future how the things are changing. But a good clinical examination with a visual acuity testing, a fundus examination, all done without any investigative modality, just by a clinician, is good enough to start and document the things for your future.
And how soon or how often should a diabetic get his eye test done? Only when they face a problem, or is it a regular interval?
No, so yearly is the best time to get it done. Even while you don't have it, even while you don't have any ocular problem, or even while you don't have any retinopathy, or doctor has told there is no sign of retinopathy, still every year is the best time to get it done. Once you have it, then it becomes more frequent, and a medical, I would say, requirement becomes more frequent. When we treat or when we have seen that the diabetes is progressing, then we call them more often. Otherwise, yearly checkup is good.
And you had used the word glaucoma. Now, can glaucoma and diabetic retinopathy happen together? What is the reason for the same, and how should one prevent it?
So they coexist. Diabetes often causes faster deterioration or progression of glaucoma. More than that, I would say people are so worried sometimes about diabetic retinopathy that they fail to treat glaucoma, or they are not worried about glaucoma medicines. And lastly, diabetic per se, if left untreated for a very long period of time, can cause a very devastating glaucoma. That's a neovascular glaucoma, which actually is blinding to the eye. Those are the patients. And I can tell you, we see many patients who come to us at this stage where they've lost one eye and they're about to lose the other eye. That's the kind of impact diabetes has on the vision. So glaucoma progresses faster in diabetes, to sum it up. And there are other types of glaucomas which diabetes per se can also cause.
Right. So Dr. Singhvi, is it also true that diabetes causes early age cataract? What are the usual causes, and is it very, very common?
I won't say it is very common, but yes, diabetes does cause cataract early. So if the cataract was supposed to happen at the age of 60, 70 years, it would cause it around 45, 55 years. But we have seen multiple patients where uncontrolled diabetes can accelerate or cause urgent cataracts even at the age of 20, 25, 30 years. More so in the insulin dependence, but yes, very early in uncontrolled diabetes. So it's a known thing that yes, diabetes accelerates glaucoma, diabetes accelerates cataract formation, and uncontrolled diabetes can cause emergency or an urgent cataract also.
So, Dr. Singhvi, does family history, you had mentioned that people with family history must get their diabetes checked and also visit a ophthalmologist, regularly. Now, does family history play an integral role in eye-related ailments due to diabetes?
Yes. See, first of all, we have seen diabetics run in families. So there is definitely a role of inheritance of diabetes to the next generation. Important part is once you know that, and once you know your brother has it or your father has it, start getting checkup yourself at a certain stage. I would say a basic checkup and then follow it up as the doctor says. Retinopathy, see, approximately 15 to 17% of Indian diabetic population has retinopathies, which is quite high. Retinopathies also shows a similar trend where if parents or the progeny has more retinopathy chances, they are likely to be similar in the next generation. So it's more so important for people who have had parents having diabetic retinopathy to get themselves checked frequently, even though they don't have it now, and their family members who don't still have diabetes to get themselves checked to be detected earliest.
Awesome. So, Dr. Singhvi, once a person has retinopathy, diabetic retinopathy, what is the course of treatment? What needs to be done?
So as I said, we have to stage it, which stage the diabetes is. We have to see, first of all, what do we do when a patient comes? We say, let's assess how controlled his diabetes has been for past. Does he have other ailments of diabetes related? Get a proper physical examination done, or a diabetologist examination where he tells about what the renal functions are, what the nephropathy is like, as I said, what the hypertension is like, because these are all the parameters which will help him prevent further deterioration of diabetic retinopathy. One. After we have done our clinical examination and seen if it's an early diabetic retinopathy, we ask them to come for follow-ups frequently, once in a year kind. If there is certain progression seen and there are hemorrhages and there is some macular edema developing, then we have to investigate them, as I said, through OCTs, through angiography, to find out the leaking areas, the leaking vessels. We try and, I would say, patch them or block them, or rather, it's a bad word, but practically we burn them. We burn those areas and we block the vessels which are leaky. Now the doctor has done his job. The point is, if you don't keep your diabetes under control, you're bound to develop new leaky areas. That's what happens. I mean, everything practically is in hand of patients. Doctor will keep on burning and blocking the leaking vessels, and one day would come when there will be no area left to see. So the most important part is how you control your diabetes. That's basic. How you control the other complications of diabetes with you. For example, if there is cholesterol lipid profile developing, more vessels would become more leaky. So these all things have to go together. You have to be treated by a diabetologist, and doctor will use lasers to block them, injections to cure your edema, implants to take care of your persistent chronic edemas. But if your diabetes and systemic ailments are not controlled, they'll come again. Similar diseases or similar retinopathies, or in more severe form, are likely to come again.
Got it. So what I hear you say is that you can only correct the problem that is there, but you can't cure the reason because of which it is happening. So that cure is basically controlling your diabetes, right? Got it. How can one mitigate the risks caused by diabetes on the eyes? And what does a person need to do to ensure that they live a good quality life just as a normal person, even when they have diabetes?
It's a, as we said, it's a lifestyle disease. So you have to modify your life. Lifestyle has to be modified. You have to do exercises regularly, or if you are at an age where exercise or a rigorous exercise is not advised, you can do good walk. That's the best. Walking, jogging, exercising is actually curing your diabetes by a huge amount. Get yourself treated well by a diabetologist. Don't ever think that your sugar levels are not important, or if they are very, very high, only then it's a cause of concern. Don't believe in short-term sugar, I would say, checkups. Get your HB1ACs done regularly to know the sugar levels for past 3 months. Eat well, exercise well, sleep well, get yourself checked regularly with ophthalmologists. These are the only ways actually. We don't have a magic wand. We have advanced machines to give back you the vision you have lost. But you have more advanced, I would say, your lifestyle change, which will prevent it from getting it worse again. So that's where it is. It's a combination of the two which works, the doctor and the patient's lifestyle.
Got it. Got it. So how is your organization working on the development of the R&D in dealing with this specific domain? And the reason I'm asking you is because you spoke that, you have the modern machines now that have, kind of enabled the tech to give you a better diagnosis, better treatment in this field. How is technology making a difference, and what is it that your organization is doing about it?
So, see, once the patient comes to us, we can very well treat. As I told you in the past also, the problem is the period of 2 to 5 years by the time they reach us. To prevent that and to help that, what we have started doing is, at few places, we have started keeping at diabetologist's place the non-mediatic fundus camera. So why a non-mediatic fundus camera? Let me just tell you about it. When a diabetic comes to our place for a retinopathy checkup, we would dilate a patient, we would see him for the whole fundus. Actually speaking, that is required at a progressive stage. When the diabetes has advanced so much, is there a peripheral part also of the retina which is involved? Usually diabetes starts at the central part of the retina. So if the central part is only to be screened, you don't require a complete fundus dilatation, which would actually hamper your work for next few hours. You would be waiting for half an hour to 1 hour at the hospital, then next 4 or 5 hours are gone because the fundus was dilated. You would have sensitivity towards light. You cannot do reading activities. Your distance vision would also be partly blurred because of excess entry to the light. And occasionally there might be some attack of a narrow angle glaucoma if your eyes are so crowded with the angles. So these are things which can happen when you do a dilatation. So there are ways and means now, like non-mediatic fundus camera, which would only screen the central part of the retina, which is actually susceptible to the initial part of the diabetes. So the screening time, the screening a patient becomes very easy for the people who are going to visit diabetologists, because for eye ailments, they would come at a very late stage. So this 2 to 5 years period, there is a scope of screening them. We make our person sit there at the diabetologist clinic to screen them, maybe at free of cost or minimum charges, just to make them. And why do we charge? We are not spending much. We charge just to make patient feel important about it. He knows that he's paid for something, he needs to take care in future about it, and he has to preserve this photograph just to take care how is it progressing. So this is just a small step which we have started taking care of. Regarding some R&D developments, I don't say that we have developed much, but yes, latest technology, latest biosimilar products which have come from imported, as well as now Indian market had started producing it, and India will become, and I can tell you, India will become one of the biggest exporter of biosimilar products soon. So, and at a very, I would say, compared to an imported one, a very nominal price. So as we saw in vaccine, the same thing is going to happen in the biosimilar products of retinopathies in India very soon and overseas also. So combination of all latest technology for laser, where the patient sits for the minimum time, the advanced constellations and vitrectomy machines, and these biosimilar products of antivascular endothelial growth factor, which are known as anti-VEGFs. These are the latest products which would, actually speaking, work very fast, cure very fast, the kind of, not cure, but subside the inflammation and the leakages faster than what the laser can do. So these have upgraded the, I would say, the treatment results as well as your field changes. But then again, same thing holds true. We can treat it temporarily. You have to cure it or control it for a very long time.
What is your message on the World Diabetes Day to people?
First of all, diabetes is dangerous. Don't take it lightly. It's our body, it's our eyes, it's our health. So probably it's only our responsibility towards it. Nobody else can help you more than yourself. Doctor can only cure it or dampen it partly. You have to maintain it. So take it seriously. And it's all about your eyes. So you have to be responsible.
Dr. Singhvi, thank you so much for taking out time to speak with us on the World Diabetes Day. We really appreciate it. I'm sure every person who's watching this video will find it extremely useful and lead a quality life.
Thank you, Arvind. Thanks a lot.
Eating right is the mantra to treat diabetes faster. But what that right amount is a big puzzle. Now, to solve this puzzle and to tell us what to eat and what to avoid, we have with us Ms. Bhakti Samant, Chief Dietitian, Kokilaben Dhirubhai Ambani Hospital, Mumbai.
Food and nutrition plays an important role in the management of diabetes. Now, to educate our audience on the aspect of the diet that diabetics need to follow, we have with us Dr. Bhakti Samant, who is the Chief Dietitian at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. She specializes in ensuring internal nutrition, diet for women in gestational diabetes, pediatric nutrition, both pre and post bariatric surgery, and ketogenic diet in treatment of epilepsy. Welcome to BW Healthcare World, Dr. Bhakti Samant. So, Dr. Bhakti Samant, thank you so much for joining us on BW Healthcare World on the occasion of the World Diabetes Day. Let us begin with the first question, that having diabetes itself is considered as a challenge by anyone who's been declared as diabetic. How do you counsel parents if the children are diagnosed with type 1 diabetes, and what foods are beneficial in the neonatal stage and early childhood, in your opinion?
Okay, see, one of the things that one needs to understand is type 1 and type 2. There's a difference between these two diabetes. Okay, when we're talking about type 1 diabetes, the child, if it's a newly diagnosed, just diagnosed as type 1 diabetic, it comes in as a shock for the patient, for the family. So we have to deal with these with a lot of sensitivity, because we know here the patient is not able to produce insulin in the body, or there's an insulin deficiency, and we have to provide insulin as an external source through injectables. That's the only way to, deal with patients with type 1 diabetes. So first thing, a lot of counseling goes into in trying to make them understand, trying to make the parents understand that it is, though it's a cumbersome, thing initially to start off with, but it is not painful. So we need to educate them. And so that is one part. Coming to the dietary part, now we deal a little different way when it comes to type 1 diabetes. It's not like you cannot eat so and so foodstuffs, and so and so food groups are going to be eliminated from your diet. No, now this child is going to be insulin dependent forever. Okay, he must be diagnosed at the age of 2 years, 3 years, 4 years, 10 years. You never know at what stage the diagnosis comes in. But now the child is going to be insulin dependent, going to be taking insulin injections every time. So we go by a concept called as carbohydrate counting for these kids, where we help them, we make them understand how to count your carbohydrates based on the insulin dosage that you are taking. And we also tweak and we also try and help them to adjust their insulin doses or their diet based on how the sugars are fluctuating. So restriction as such comes in terms of the amount of carbohydrate that we tell them, and it can come from different food groups. So we don't give them a calorie charting, we give them carbohydrate charting, where they can select that, okay, for my breakfast, if I can take 100 grams of carbohydrate, then how many food groups with that much amount of carbohydrate can he consume? So they can select. So there is no variety in that. So this is the, I would say, it takes a lot of time and effort because you have to help them to be independent. So first, to explain them the calculations that we do, we have to explain them to do. So it takes a little bit of time and effort. So that is where, I think at least 3-4 sessions are required. And once they start managing themselves, they're more confident. Then they don't have to come and see the dietitian very often. But there are a lot of aspects that, psychologically, physically, emotionally, that we have to help them.
Right. Dr. Samant, how big is the role, in your opinion, about the bad eating habits are playing in increasing the diabetes burden in our country?
I would say 90%. 90% is the bad food, and the additional 10% can be the other associated, non-modifiable factors that we call, whether it can be your age or your family history, or it can be, there are certain things which are beyond your control. Right. That will come up to say maybe 10%, but majority is what you're eating, how much you are eating, your lifestyle, which is what is 90% is dependent on that.
But do you think things have changed in the last 2 or 3 decades to make it worse, that we are now the diabetic capital of the world?
Oh, if I have to share the data, I think ICMR had published data in 2017 regarding the percentage of diabetics in India, where if I can share with you the statistics, which shows 7.3%, almost 7% of our population is already having diabetes, and out of which say around 10% are pre-diabetic. What is more alarming is that 40% or more than 45% of our population are not diagnosed only. So you can see the burden that that is there for diabetes. So it is growing very fast, and lifestyle modifications is what is, our lifestyles are going more towards westernized lifestyle. Our physical activities are going down. Dependency on processed foods are going high. So I think that's where things are going on the wrong track.
So, Dr. Samant, youngsters these days are found to be having high cholesterol, which was not the case earlier. And even because of high cholesterol and the related lifestyle disorders, we're moving towards high diabetes among the young people. Now, do you think bad eating habits are in play here in a big way? How can this contribute to the overall development of health of the population that we are bringing up? I mean, India is a very young nation. And it could be a very big medical challenge for our country.
So I think we are now in the post-COVID era. So I think pre-COVID and post-COVID, pre-COVID also, I would say people were mainly talking about, the heart problem or the cardiac problem or the diabetes and all that. And post-COVID also, people have realized that how important is to have a healthy, a good health, good immunity to combat any kind of virus or any kind of, side effects of these viruses. So I think post-COVID, one thing that I think what we see most common is that the physical activity, which is what is dropped. I would say there has been pros and cons that during COVID we realized how much social media or how much virtually we can still manage our work sitting at our places and still manage. But I think that is also what has increased the burden as far as health is considered, because there are two types of individuals. Like most of the time post COVID, when patients are coming to me or even on OPD basis, we are seeing patients 5-10% of them who have utilized that phase to improve their health, and the remaining 80-90% of those who are coming because of work from home, because of being screen time being high, lack of physical activity, calling food from the online portals, I would not name, but yes, it has actually taken a complete toll on their health. So those who were, say, absolutely normal, consulting only maybe for a little extra weight that they were carrying, now when they are coming in the OPD, they are coming with a high cholesterol, they are coming with a pre-diabetic stage. And so I think awareness, even though we are very well aware, people are more conscious about their health, but still there still needs to be a lot of awareness about diabetes in the population, because we're still going seeing it grow. So yeah, that's a very big challenge, and I think even at a government level they should also try and take up more such awareness programs, which will help, because at a corporate level we try and do whatever our bits that we do through our marketing events and all for our corporate events or the wellness that we do, but still a lot more work needs to be done in this area.
Right. So Dr. Samant, what are some of the best foods that keep yourself healthy if they have been diagnosed with type 2 diabetes? Also people find it usually that the recommended food for diabetics seems to be boring, not palatable. How do you recommend food for diabetics which is tasty, people enjoy it and they feel good about it?
So number one, most important thing when someone is trying to, come for any dietary modification or any lifestyle modification, we try and do modifications which are more close to their regular eating habits, like telling a Gujarati not to have khakra or telling a Punjabi not to have a paratha. That patient is never going to comply. So within the normal eating habits that they have, we try and do a modification. And also one has to understand that there are no standard diets. For each one, it's going to be individualized based on what are the readings of their blood sugars. So if someone who is a controlled diabetic, definitely the restrictions are lesser. It's more of a balanced meal that you would provide. But someone with uncontrolled diabetes, there are a lot of modifications that we need to do. But I think we've come to a time or a phase where just talking about food groups is not going to help. So if you ask me in terms of food groups, we have our cereals, we have our pulses, we have our nuts, we have milk, we have fruits, we have vegetables. These are basically what we eat. Meat and poultry comes in for the non-vegetarians. So all of these food groups have their own, I would say, nutritional benefits and their nutritional components which are important. So to have a balance of these nutrients is what is important. And secondly, how are you actually cooking your food? So I think now we need to start going a little more in detail about not just about the food. How you are making your food is what is very important. Like we say, an apple a day keeps a doctor away. But if you're going to have an apple juice every day, you're not going to be away from the diabetologist, right? So these things are very important. So your processing and packaging is now what is coming into a concept where we are trying to educate our patients more in that direction. That eating chicken is not a problem. But if you're going to have fried chicken versus homemade, say a vegetable-based chicken, is obviously a better option, right? So it is the way you're going to cook your food is also what is going to be, making a difference. And if you allow me, there is one more major point which I think we as Indians, why we are seeing this sudden, increase or the rapid increase in the diabetes, the number of patients that are increasing. We as Indians, we are a mixed population with a lot of communities, a lot of religions, where they are vegetarian, non-vegetarian. But if you look at overall dietary habits of our Indians, we are mainly a vegetarian population, or rather a population who is having low intake of proteins in the diet. So here your composition of the meal plays a very important role. So your carbohydrate, proteins, and fats, that is what we play with when a patient is going to come with us. So if your protein intake is very low, a simple mathematics that I have to make or do for a patient's recall is that if the protein is low, out of that 100%, the carbohydrate content is going to be high and the fat content is going to be high. We're talking in terms of percentage, not even talking about how much of roti or how much of chawal that patient is having. But if the protein is low, your carbohydrate and fat percentage is going to be high. And that is what we have to correct. So to improve the protein intake is what is very, very important. Like our traditions, like Maharashtrians have a certain meal patterns that they eat, or Punjabis have a certain meal pattern they eat. What we have done over a period of time, as per our comfort and as per to fit in with our lifestyle, our roti, sabzi, dal, chawal, which was a full meal, is now either a chapati bhaji or it is only a dal chawal. Right? So here the balance, the plate when you're looking at, and the balance of nutrients in your plate is what is missing, where you will have your carbs. So we love our carbs, we love our rice, we love our parathas, we love our doklas, we love all those things. And in that bargain, what we are missing out are our dals, pulses, milk, curd. And I think I wouldn't blame just the population in general, but a lot of myths even about certain food groups are floating on the social media, which, people end up following blindly. So I think that is what we need to correct right now. And that's exactly why we are seeing that increase in type 2 diabetes right now.
Well, I'm glad that you brought this up, that the geographical parameters of our country, we have varied food habits, but still there is a lot of commonality in terms of what food bracket or for what food group is what is prominent. But since you brought up proteins, Dr. Samant, there is one question that came into my mind, and this is an outcome of another conversation that I had with another doctor a few weeks ago. And there was a debate about animal proteins versus plant-based proteins. And there was a confusion. And that is where I need clarity from you, since you are a specialist in this area, that do animal-based proteins or excessive animal-based proteins lead to cancer?
Okay, so I think let me put it this way. It is the processed animal meat protein. So more processings, if you are going to have, say, animal meat, like suppose instead of cooking chicken, getting chicken and cooking at home versus getting a salami or a patty, which is already processed, and having that intake to a larger extent, definitely is going to be more harmful. Comparing the quality of protein between a plant-based protein and animal-based protein, there is one thing that it all depends on the amino acids, what amino acids we get from these foods. So if you have to compare the quality of protein, animal protein is a first-class protein versus plant protein or the plant sources, they are called second-class proteins, like what we get from dals and pulses. So when I say second-class, it means that when I consume one egg, I get 100% protein of that egg, versus when I consume a bowl of dal, I get only 60% of the proteins in my body. But there are ways in which we can convert our second-class protein to first-class protein. So those are the combinations that we try and help the patient to do, because not everyone is an vegetarian, not everyone is a non-vegetarian. So within the vegetarian diet also, doing a cereal pulse combination, having the right balance in terms of the components in your meal can help you to improve the protein quality in the meal. So these are two debates that I think, but if you're talking about processed foods, not only animal foods, but even the vegetarian processed foods in the market is something that you should try and limit in your diet.
I'm glad that you brought this up, because this clarifies a lot of things which are myths. So are there any other such food myths that are associated with diabetes?
Talking about myths, I mean, there are sometimes patients who come up with their own myth, but I think one very common thing that I come across from almost all, I would say 90-95% of my patients is that, when I see their reports and I tell them that, okay, your reading is a pre-diabetic reading and we need to work on that. So the first thing that comes across is that, no, I don't take any sugar in my diet. How can I get diabetes? So this is one of the biggest myth that I would want to, clarify, that it's not just the sugar or the sugary components in the diet, which is what is going to lead to insulin resistance or type 2 diabetes. It is the overall diet, the percentages that we were talking about. So I think this is one of the myths. And another myth is that, okay, sugar is bad for diabetics, but honey and jaggery are very good. So one has to understand sugar, honey, jaggery, whatever you consume, in the end, the body is going to break it down to sugars. And if you have insulin resistance, so those sugars are only and only going to be in your blood. They are not going to be absorbed because there's resistance already. So it is still going to spike your sugars more. So these are two things I think which are very common, and I think people need to understand that.
Absolutely, absolutely. Dr. Samant, can initial diabetes be reversed by managing just the food habits? And is there some special diet that one must follow with once sugar levels go beyond, the sugar levels, accepted sugar levels for a longer period of time?
Okay. So when we're talking about initial diabetes, when we talk about pre-diabetes, that means when your HbA1c is between 5.7 to 6.4, there is no medication management any diabetologist will be giving to the patient. Okay. This is the stage which can be reversed. When we're talking about full-fledged diabetes, when someone is already diagnosed with type 2 diabetes, remission is possible. That is, we modify the diet, we do the modifications, do the lifestyle modifications where we are able to get it within the acceptable range. But you'll always be a diabetic. You'll be known a diabetic because you have to control it always, because there are chances where it can come back if you change your lifestyle. So reversal, initial phase, pre-diabetic phase. But when you're talking about full-fledged diabetes, it is called remission and not reversal. So remission, very well possible. In fact, recently there are studies which have said that with the dietary modifications and the lifestyle modification, that the type 2 diabetes remission is possible. They have observed that.
Dr. Samant, let me come to a separate, set of patients, and it is extremely important. Is there a diet that expecting mothers should follow to avoid the gestational diabetes?
Okay. Now see, you need to understand the difference. When we're talking about gestational diabetes, the definition per se says it is the diabetes that you will see which will develop during pregnancy. Okay, it is one of the effects that has happened during pregnancy. So it is mostly diagnosed at the 24th week of gestation. We're talking about individuals who are already pre-diabetic and getting pregnant are definitely going to, have a higher sugars during their pregnancy. And there is a possibility that they will remain, they will continue to, have higher sugars and be diagnosed as type 2 diabetics post-delivery. Whereas if it is a pure gestational diabetes, 80% of the time, the females post-delivery become absolutely normal. So these are two different conditions that we are talking about. Now, if we know someone is someone has been diagnosed with gestational diabetes, we definitely try and do 2-3 modifications. One is to control on the weight of the patient, because that's the time where the weight gain is going to happen. So an initial assessment, if the female was a normal weight female, then we say a normal target of say 9 to 10 kgs is what we target during pregnancy. If we're looking at an obese individual and a female who is already obese or overweight before pregnancy, then we try and limit the weight gain to what is necessary, say 5 to 6 kgs. Okay, that is one thing. And that is possible only through the dietary modifications. Now, in such cases, like for a typical type 2 diabetic, I can go a little low in carbohydrate. But for a pregnant female, we don't want to reduce or put them on a low carbohydrate diet. So here plays the role by giving them more sources of carbohydrate coming from fiber, coming from protein group, and that's how we try and balance their sugars, because again, that's a phase where no one wants to be on a restricted diet. But yes, those are I would say set of patients who give you 100% results. because they know that their health is what is going to, pass on to their the newborn babies or their neonates. So definitely they 100% comply to what guidance is given to them.
Absolutely, absolutely. Now, Dr. Saman, very interesting question that comes to my mind is that most diabetics crave for sweets. And especially when they become diabetic, it's all the more reason they go in for, sweets. Now, my question to you is it psychological or is it something that happens as a result of diabetes that their craving for sweets goes up?
Okay, understand the physiology. हम normally खाना खाते हैं, we eat our food, whatever you eat, carbohydrate, protein, fats, whatever normal food that you eat, it's broken down into sugars. We have a carbohydrate metabolism. The humans have a carbohydrate metabolism. We use sugar as our source of energy to do our daily activities, sitting, walking, talking, sleeping, whatever. Now, what is happening is insulin. So insulin plays a very important role. It's a hormone which is very, very important to, do all these functions in the body. So insulin is what is helping the sugars to be, to pass on from the blood to the cells, which gives us the energy. Now you have to understand, if it's a type 2 diabetic patient has insulin, but there is insulin resistance. The body, the cells are not able to identify insulin. So insulin is not able to, perform the activities it is supposed to perform. So in this case, whatever you are eating, it's breaking down into sugars. It's in your blood. But sugars is supposed to be in the cells. So if you are not on medication or if you are undiagnosed, not on any treatment for insulin resistance or type 2 diabetes, the sugars in the blood will keep on increasing. But your cells are starving of sugars. That's exactly why they are craving for sugars. That even after eating, they don't feel full. So that is one scenario where we see that, which is a physiologic change. So you will see that type 2 diabetic patients, when are treated with the right diet and with medication, the insulin resistance is balanced out. They are able to utilize these sugars better and their blood sugar levels come down. That's where the cravings will go down. So this is the physiologic response which is happening in the body, which I think once the patients understand. So once I explain it to them, they also think it logically and they more are complying towards the dietary restrictions that we give them. That at such times, if you keep on having sugar, the sugar will keep on increasing in the blood. Every time you do a blood prick, you will see that the sugars are high. Whereas you are starving, you're not getting enough food to eat, right? So that is where we need to correct them. But there are also certain set of patients, like I would say type 1 patient, not really type 1, but those who are dependent on insulin. Not all who are dependent are type 1, but elderly patients and all, they understand that in case of hypoglycemia, we have to take sugar. So there are patients who purposely would, take extra sugar thinking that they are in a hypo. So this is also a very, a dicey situation, because this is also very harmful. But yes, majorly the physiologic response that I told you, so it is obvious. If the sugars are high, they are going to crave. But if their sugars are stable, their craving will be much controlled.
Got it. Got it. So, Dr. Saman, the moment people who are diabetes, they have a craving for sugar, or they are looking for, to include desserts and sweets in their food, they move on to artificial sweeteners. They have they're adding artificial sweeteners to their desserts, custard and everything. Now, is that fine to do? What are the negatives of doing that? And also my question extended to this is that, what about sugar-free drinks, diet foods? You have diet ice cream, you have sugar-free ice cream also that is coming in. There are diet soft drinks. What is your take on this?
Okay, so as I said, I very strongly believe all the health issues, like the diet that we have a very carb-rich diet. Everything that we eat is very carbohydrate-rich. On top of that, the desserts, the sweets, the sugar, recipes, they are all a very close part of our diet. Every festival is going to be a shira, a puja, a shira. Every festival there is going to be a sweet. So it's all adding on to your existing content of carbohydrate. So that is one. Now, if I have to balance it out, I do a balancing with my normal diet where I am cutting off whatever visible sugars that I can cut off. Now, desserts, sweets, or sweet tooth. Now, we don't want you to consume it on a daily basis. Okay, so you have to understand they are not a part of our daily diet. Those are occasional intake. So as far as these things are taken on an occasional basis and you are using a sweetener in those, your desserts or the sweets that you are eating is absolutely fine. When you talk about sweeteners, they are called non-nutritive sweeteners because there is no nutrition value that you are getting from them. There are different types of sweeteners available now, even a lot of natural sweeteners available, like sugar polyols that we call them. They are more natural. Stevia, which is more natural. And there are certain artificial sweeteners, but they are all prepared from the food products only. Okay. Only thing different from the regular sugar is that they are going to be 200, 300 times sweeter than the regular sugar, and that's how it is helping us to have the sweet taste in the food that we are having. They are without adding any calories. Now, like we have for carbohydrate, proteins, and fats, recommended dietary allowance, the same way for sweeteners, non-nutritive sweeteners, we have an acceptable daily intake. And if you go by that intake, so if you look at these products which are available in the market, they even mention how many pallets you can have in a day or how many sachets you can have in a day. That is based on the ADA, which are guidelines available very clearly, and they are all safe within that limit. Having said that, someone, just because we have said it is okay, chai mein bhi dala, sabzi mein bhi dala, dal mein bhi dal ke le rahe hai, don't do that. Those are going to be, it is just helping you to add that sweet taste that you would want maybe in a little bit of a kheer that you will have, like a milk-based dessert. Why not? Milk is protein. I'm going to minus the sugar and I'm going to add a sugar-free. I am able to enjoy that kheer with a sweet taste without really, thinking about the calories. So yes, they are safe. Taken in their accepted daily allowances, absolutely safe.
Okay, I have a trick question, or at least I consider it to be a trick question. Is it okay to have a cheat day where you have a dessert versus moving on towards artificial sweeteners?
Okay, so now if you're talking about general population, yes, it is fine. Once in a while have a dessert, no problem. When we're talking about diabetics, again, in that, if they are controlled diabetics, yes, once in a while will not, shoot up your sugars that much. But if you have uncontrolled diabetes, then definitely not recommended. I would shift to a sweetener in that case. So at what stage of diabetes and the type of patients, now you have to also understand here the psychology. Many a times we give a prescription not just based on the RDA which is given to us, like the recommended dietary allowance. We have to also look at the type of patient, how compliant the patient is, or whether they are going to be non-compliant. Then for such patients, if I say, "Theek hai, chalo, once in a while you take a dessert," then once in a while will become once in every alternate day, right? So based on that, we would give a recommendation. If a controlled diabetic, yes, very well, you can have a sweet in a smaller proportion, no problem. But if uncontrolled, not at that stage.
What about alcohol?
Okay, now problem with alcohol is that, see, the calories, so it doesn't have carbohydrates, but the calories that you get from them are empty calories. Problem is when you're having alcohol, the food that you eat along with alcohol, that's the issue, right? So the side dishes that are there, the fried snacks or the nuts or the fried stuff that you are going to eat with it, so that's a problem. So again, a controlled diabetic, yes, can once in a while indulge in a moderate consumption of alcohol. Now you ask me what is moderate consumption. Sadly, whatever data is available or the recommendations are not on Indians. It's on the Mediterranean diet because alcohol is a part of their diet. Alcohol is not a part of our Indian diet, right? So what I tell my patients who are controlled diabetics or who are able to do a portion control, that when they're having alcohol, to make sure that the food that they eat is the protein-rich food, to have say tikkas or kebabs, which are protein-rich, which they help, along with a bowl of salad or salad sticks, so that the fiber is also balanced out. And then to not move to eating a full meal after that. Okay, so I think that if you are doing, who are controlled diabetics can have it, but again, frequency will vary. So frequency we need to work around.
So if I hear you correct, if you're adding something in your diet, you need to balance it by removing something else that day.
Yes, balance and moderation is the key.
Awesome, awesome. Now, Dr. Samant, what do you recommend diabetic patients should ideally keep with them handy if they feel that their sugar levels are dropping? Because sometimes they're taking medicine and they've started exercise and suddenly they feel that their sugar levels go down. What is your point of view on this?
So see, scientifically, what we recommend is we call it a rule of 15. That if the sugar levels are low, now what do you call a low sugar? Low sugar is where your blood sugars are less than 80 milligrams per DL or 70 milligrams per DL or lesser than that. That's where you will start having symptoms of hypoglycemia. The heart rate might increase, you'll start sweating, you might start getting blackouts. These are the typical symptoms that show that you are maybe getting into hypoglycemia. So knowing the blood sugars is important. So you check the sugars. If the sugars are below 80, yes. What do we give at that time? The best thing to give would be 15 grams of sugar, or you get these glucose tabs are available. There are also glucose tabs which are available. You can take those, wait for 15 minutes and then recheck the sugars. If the sugars are still below 80, please don't do any more intervention. Call the doctor and take a medical advice. If it's above 80, you don't need to do anything. The sugars will normalize gradually. So we call it a rule of 15 grams sugar. Wait for 15 minutes, check the sugars again. This is the best thing that can do. One of the things that most people can do wrong is to eat a chocolate. Anything with fat should not be eaten when you are having a hypoglycemia. It will stop or slow down the release of sugar. So something which is pure sugar or a sugar, what do you call it? Sugar candy or so. So 15 grams is what we recommend.
Got it.
Things should be there with them.
Got it. Now, Dr. Samant, the problem with the kids is that if you were to control their habits, they don't understand, right? So how can parents explain to the kids and make food interesting in case the child is type 1 diabetic?
Okay, now see, there are two things. You're talking about type 1 diabetic. Now, see, for type 1 diabetic, as I told you, we go by carbohydrate counting. So we don't restrict their diet. You have to understand they're going to be on insulin forever. For every meal, they're dependent on insulin. So for them, it works on initially if it's a recently detected, yes, for a month or two, where we try to understand how the sugars are fluctuating and to come up with an insulin dosage for them and help them with the carbs. Now, long term, they are going to go out, they are going to have sandwiches, they are going to have wafers, they are going to have fries, but then we give them the data as to if you're eating so many fries, how much is the carbohydrate. So they have to balance out. So if the allowance is say 50 grams, then okay, if my 20 grams have come from fries, then my remaining 30 grams has to come from some other source. And this much is the amount of insulin that I'm supposed to take. Or if I'm eating something extra, instead of 100, I'm eating 120 grams of carbohydrate, then I have to take 2 units of insulin extra. So that is how we deal with those kids. So type 1 kids, it is not a restricted diet, but we try and adjust their intake based on their sugar eating and help them with insulin tweaking. That's the way for them. When we're talking about, in general, kids with obesity or with pre-diabetes who come for a consultation, I'll tell you my experience so far. Kids are absolutely compliant. It is the parents who are not compliant. So, I mean, they feel that they are punishing their child if they are not giving them a chocolate or not giving them some sugar in their diet. So I think whenever there is a child who's there as a patient, I would always want the parents to be around. And in front of the parents, the child is counseled. And that's where all the questions are, handled. So there are different ways we will deal with in these conditions.
You hit a very sensitive area, because I'm too intrigued to ask this question to you, is that irrespective of whether the child is eating as per the age, what is required, but the mother always feels that my child does not eat enough, right? Now, what is a diet of a normal child between the age of, you say, a 6 to a 10-year-old that is all right to eat? I mean, are we pushing our kids towards obesity by overfeeding them?
Yeah. So one of the very important things for kids, where we decide whether they are enough, whether their growth is correct or not, is by growth charts. So for kids, we don't check their weight to see whether they are obese or underweight. We check their weight so that their weight can be plotted on the growth charts to see whether they are growing as per the growth chart that they are supposed to. So that's number one. So if the growth is as per the growth charts, we are doing fine. Secondly, if the child is indulging into enough physical activity, the age group that you mentioned, they are going to be doing a lot of physical activity, right? Whether they go for playing or they do activities even in the house. So if they are physically active, that is the second thing. Now, during COVID, we've seen a lot of kids sitting at home has put on a lot of weight because I think the family members have tried to, in fact, you won't believe, it's really funny that the statistic says that the sales of the confectionaries have tripled during COVID. Right. So a lot of people have tried to be master chefs at home and have been trying a lot of recipes. And that's common for all the patients whom, I have consulted so far, that they will say कि नहीं during COVID हमने बहुत सारे recipes बनाए, बहुत सारा bread बनाया, cakes बनाया, pastries बनाया और खुद खाया और सबको खिलाया. So physical activity is one very important thing. Coming to the food part. From the time the child is 1 year, so 1 year age, we expect the child to be eating the same food that the parents are eating. Obviously, in lesser proportions, but the same components in terms of the meals, normal food, chewing properly is what we say. So when we're talking about a 6 to 8 year old also, sometimes we have to understand the need. Don't overfeed. Also, do not feed sugary and snacky, like we tend to put extra ghee in their food because we feel that they need it. We tend to add extra sugar in the desserts that they eat because we feel that they need it. That's not the case. Okay, sugar, fat, and all recommendations are not high for them. They are supposed to be eating all food groups that we eat in a proper balance. So yes, timely giving them the meals, timing it, say maybe every 3 hours or so, giving them meals in smaller proportions throughout the day, help them to keep their energy levels good so that their physical activity is good. So that is what we are looking at even in that age group. We are not, we don't want them to indulge a lot of packaged foods, which I feel is sadly the case now. A lot of packaged food intake on a weekly basis, like our evening time are the time where the child, if the parents are working, would end up eating a Maggie or would end up eating biscuits. So these have become a part of our diet, which was not the case before. Those things are the culprit.
Got it. Dr. Samant, my last question for the day to you is, what is the advice that you would want to give to our audience on the World Diabetes Day? Are there any tips and hacks that you would want to share with us to help diabetic patients lead a quality and long life, especially the foodies who now have diabetes? They want to, but they want to lead a quality life as well.
So when we're talking about food, it is quantity, what you are eating. So the way you're making your food, like I said, not just about eating certain food groups, but the way you're cooking your food. So how much oil you are adding in your food. So that is very important. Even if you're eating out, or even if you're indulging in outside food or in junk food, frequency. You cannot be doing that every alternate day. So I would say put it in this way to have a balance. It's important that at least 5 to 6 days a week, you try and stick to a normal pattern, and you can have a little bit of leeway, say once a week when you are with your family. Don't go all out. Like you had a cheat meal in your breakfast, you had a cheat meal in your lunch, dinner. Don't do that, because all your efforts for those 6 days go down the drain. So that is one thing. And make sure to incorporate some form of physical activity. When I say physical activity, doesn't necessarily mean going and hitting the gym. It can just be dancing, it can be cycling, it can be swimming, it can be simple walking. Take up an activity that you all enjoy. Please don't go by the herd mentality. If you enjoy dancing, please enroll yourself into dancing. If you enjoy doing aerobics, please do that. If you enjoy doing gymming, yes, please go and do that. If you don't like anything, at least walk. So these things are important. Sleep hygiene is very, very important. We are seeing a lot of disturbances in hormonal metabolisms and all that, starting with sleep deprivation. Sleeping or being awake up till midnight and then waking up late. So I think this concept also is coming up, which is called as chrononutrition, where you're not just eating what you are eating, but also at what time you are eating is very, very important. So these things one should incorporate, and hydration, last but not the least. So food, what you are eating, portion control your food, incorporate all the food groups in your food in your meals, but make sure that you are not doing a lot of frying or deep frying in your meals. When we're talking about oil, use oil as a medium of cooking and not ghee as a medium of cooking. In oil also, normal, in general, the recommendation is for any normal healthy individual, half a liter visible fat, which is oil, half a liter per person per month. So a simple rationing of, say, for 5 family members, 2.5 liters is what is your ration. Try and do cost cutting there. Don't do cost cutting anywhere else. Try and do cost cutting there. Try and eat more natural. Try and not eat things which are coming out of a packet. Processed food is what is the culprit right now. So processed, try and minimize as much as possible, hydrate yourself well, and try and incorporate at least half an hour of exercise on a daily basis, or at least moderate to intense physical activity at least 3 to 4 times a week. So that's all from my end.
So you said oil is better than ghee.
Yes, yes, yes.
Got it. Got it.
So
Now,
oil, why? Is because of the fat. When we're talking about fat, we're talking about saturated fat, unsaturated fat. Now, in general, when you use an oil, you get both. You get saturated as well as unsaturated. If you go by the recommendation says that your saturated fat intake should not be more than 7% of your total fat intake. So if you're taking milk in your diet, even if you're taking a low-fat milk, there is certain percent of milk. There is curd in the diet. You might, not use a skimmed curd, but a 2% or a 3% curd also, there is fat in your diet. Naturally also there is fat in the diet. Oil also has fat. So your saturated fat intake, you are getting enough from the dairy products that you are eating. So visibly, when you are adding more ghee, you are taking more than what you are supposed to be taking in. Yes, but if you are, say, taking skimmed curd or skimmed milk, zero fat products in the diet where the saturated intake is negligible, yes, you can incorporate ghee also as a part of your diet. But we always want the ghee component to be less. So if you ask me a thumb rule, 1/5 of the proportion. So if my 5 family members ration was 2.5 liters on a monthly basis, I would say 2 liters of oil, half kg of ghee.
Got it. Got it. Dr. Samant, this has been such a wonderful conversation, and this time the theme for the World Diabetes Day is educating around diabetes. But, what we also wanted to do was to send a message that, there are ways in which you can lead a quality life despite diabetes. And I think this conversation with you has helped us achieve both these objectives. I thank you so much from the bottom of my heart to take out time for BW Healthcare World.
Thank you. Thank you so much for inviting me.
Yoga practice is useful in the management of various lifestyle diseases, including type 2 diabetes. Incorporation of yoga practice in daily life helps to attain glycemic control and reduces the risk of complications in people with diabetes. Now, to tell us everything about yoga for diabetes, we have with us Ms. Namita Piparaiya, yoga and Ayurveda lifestyle specialist and founder, Yoganama.
Another very important aspect of managing diabetes to lead a quality and long life despite having the condition is exercising. And a traditional form of exercise in India, which is yoga, has been found to be really effective in managing diabetes, managing your sugar levels. To discuss this and to understand what are the asanas that we should be doing if we have this condition, we have with us Namita Piparaiya, who is a yoga and Ayurveda lifestyle specialist and the founder of Yoganama. So welcome Namita to BW Healthcare World, and thank you so much for taking out time to share your expertise with our audience. Namita, you have been working on 3 pillars, as I understand, yoga, Ayurveda, and you also believe in philosophy.
Yes.
Right? Now, in your opinion, people who are diabetic, can they use these 3 pillars to lead a quality lifestyle despite having this condition?
Absolutely. I would be, for any condition and even diabetes, the attitude really matters. And, sometimes we have the habit of fear mongering, don't do this, do that, this will do this, and this will do that. I think a part of philosophy is letting go of that attitude and making our peace with whatever nature or environment has given to us in terms of this body and its challenges. And there are other then interventions like yoga and Ayurveda that can then support that lifestyle. So a positive attitude definitely helps.
Lovely. Now, how does physical fitness and yoga help you lead a better lifestyle? Like I said, despite diabetes, I mean, this time, the conversation is that, okay, you have a condition, right? But what is the best that you can do to live a quality life just as a normal human being?
Yes.
So how does physical fitness and yoga help in this?
Absolutely. First, love that solution-oriented approach instead of fear-mongering. And yes, physical fitness and yoga will help. Now, yoga helps in 2 ways. For people who are inactive in general, it's a great way to get started by being physically active. And physically active is great for managing your metabolism, your insulin, your pancreas, even your heart health for that matter. So that's one aspect. We get that through practices like Surya Namaskar, which is like a low-key aerobic activity as well, if done at a good pace. And there are all these postures which move the spine in different directions, which help, influence your nervous system as well. So that's the physical fitness aspect, which we can build through yoga. And then there is the mental fitness aspect, which we also build through yoga because we use the breath and the mind through pranayama and meditation. That's the missing link you won't find in any other physical fitness activity. And yoga brings it all together for you in a very accessible, harmonious, easy to do way. You can do it at your home, in a hotel room. You can do your breathing practice even while you're sitting in the train or commuting for your work. So that's where yoga brings everything together for us.
So, Namita, women who are diabetic, right, and they get pregnant, also develop gestational diabetes, right? What do you recommend for them? Can they exercise? And if they can, what does yoga offer for them that allows them to also ensure that the life inside of them is not getting affected?
Now, when it comes to gestational diabetes, the cause is not very well understood. Well, people who are predisposed to diabetes do get that, but solutions are available, and that includes diet, exercise, and lifestyle. Good thing with yoga is, again, very accessible. Proper pregnancy yoga protocols will tell you what to do in first, second, and third trimester. Yoga evolves with your pregnancy, so it is not challenging you too much that you have to be uncomfortable, yet it is very, very healing. Another good thing about yoga is that it helps modify your dietary habits by managing your stress. A lot of times when people start yoga, and a lot of research has seen this, that yoga, along with it, automatically people start eating better. They make better eating choices, better lifestyle choices, because subconsciously we're reducing that stress. And it is that latent stress that drives us to eat sugary foods or to, just sit and binge watch Netflix because we don't want to be in the presence of our life stresses. So that way it will help women who are pregnant, but they should just make sure they follow the proper pregnancy protocols with a certified pregnancy yoga teacher. Amazing practice, accessible, and yes, it helps with gestational diabetes as well.
Lovely. Now, what are the 5 asanas that you recommend must be done by anyone who is diabetic?
Very nice. I love that question. Number 1 is sun salutation. It's really, really powerful. Multiple studies have shown that it changes the expression of how pancreas and insulin is released in the body. So 6 to 7 rounds of sun salutations at least is how somebody should begin their yoga practice. Now, sun salutations cover a lot of forward and backward bending for those who are familiar with the forward bend and a Bhujangasana. But for diabetes, in yoga, we focus in the center of the body, the Manipura chakra, as we call it. And you are going to then move the spine sideways and twisting as well. So there's Trikonasana or triangle pose, which is really good. Then there is twisting Ardha Matsyendrasana or seated spinal twist. So then with this, you complete the movement of the spine in all directions. And I will not stop at asana. I'm going to say you have to do breathing as well. Nadi Shuddhi is very, very good, as are some little more aggressive breathing practices like Bhastrika and Kapalbhati.
So, Namita, would you like to show what these asanas are so that, you know, people can understand?
Yes, yes. Let me get to the mat there, and I hope, yeah, we'll be visible. And I'm going to talk a bit louder so you can hear me. Is the sound clear here, Namita?
Yes, I think we can hear you.
Okay, great. So first I'm going to show a back bend, and that's something we use in sun salutations as well, which is cobra pose. For that, we come to lie down on the belly on our mat, hands by the chest. And what we're going to do is slowly lift up, not coming into a fully straight position. Here, what people tend to do is they straighten their hands, and then the awareness of the belly on the ground is gone. But what you really want is to breathe in this space. It's more challenging. Press the ground with the navel as you breathe in, and then as you breathe out. So this is excellent. This is challenging, so people can do it for 3 to 5 breaths only, but you can make it restorative by having, let's say, 2 blocks in front of you, resting the elbows on the blocks, and then looking forward, and spending about a minute or 2 here, breathing in and breathing out, focusing on the area of the navel. So this was a back bend. Forward bends are pretty common, but I will share one that I particularly like, which is single leg forward bend, unilateral, Janu Shirshasana. So bend one leg, straighten the other leg, and then reach forward towards the leg with the chest. Even if you are somewhere here, even if you don't get too far forward, it's absolutely fine because you need to feel the stretch. Why I'm recommending this pose is because it can also become a side bend. You go sideways, reach up, and that's a nice release to the side body as well. From here, we can move into a twist, which is keep the foot bent, reach to the side, and twist sideways, looking back. Twisting, side bending, forward bending, back bending. So that's what we are trying to focus on.
So, Namita, would you also want to do the sun salutation, which is Surya Namaskar?
Absolutely. I mean,
because the reason I'm telling you this, asking you this, is because I've seen a lot of people, they do Surya Namaskar, but they do not do it properly.
Absolutely. I know it can be quite confusing as well. So traditional Hatha style Surya Namaskar has 12 steps, and we start in a standing position. First step is simply bring the palms together, take a nice deep breath in and a slow deep breath out. Then second step is a standing back bend. You reach back as per your capacity. Try to find a nice arch in the spine. Third step, you come into a forward bend. Now here I want to highlight, going all the way down is not necessary. You need to feel the stretch. You don't need to torture the body. With regular practice, your flexibility will increase. But if you're starting out, you can even be somewhere here. Next step, take the right leg back. Knee down. And this is Ashna Sanchalan. You can breathe here. Make sure you feel a nice stretch in the front of the right hip. Next step is plank. The knees down, chest down. From here, we transition into Cobra pose, which I shared earlier. Inhale, avoid straightening the hands. Keep them slightly bent. It's more challenging. From here, Bhudarasana or downward facing dog. Here, you can adjust the position. You can widen the distance between the hands and the feet, or make them lesser, whatever is convenient to you. And then we circle back. Right foot forward, knee down. Same foot comes forward. You took the right foot back. This is where people get confused. You bring the right foot forward. Then forward bend. Choose your variation for it. Inhale, this time we look up. Hands in Namaskara, look up where the thumbs meet. Exhale, release. Then you do the second round with the left. So left will go back and left will come forward. That's your one complete set of sun salutations.
Lovely. Thank you so much, Namita, for this. Now, Namita, for how long does a person need to do this every day? And does it need to be every day?
Yeah, doesn't need to be every day. So if you're talking about sun salutations, like I said, minimum 6 rounds would be good to do. If you're looking to have a beneficial yoga practice, you need to give it at least 30 minutes or at least 20 minutes by the bare minimum. Up to 45 minutes of yoga practice done 3 to 4 times a week is really, really helpful for diabetes as well.
Lovely, lovely. So Namita, let's come to working women.
Yeah.
Because we have cultural challenges. No, I won't call it a challenge, but those are preferences that we have had in our society.
Yeah.
Working women, especially in Indian culture, they are multitasking.
Yes.
Right? So they are busy with their corporate life, and then they're taking care at home, and they are the ones who are actually most worried about the kids.
Yeah.
Right? They may not be able to take out an hour's time to go to a gym or to exercise. Is there a 10-minute regime or a 7-minute regime that you can suggest for the women who have diabetes to keep themselves healthy? I mean, like you said, you need 30 minutes time to really be effective, but is there something that they can follow in 5 to 10 minutes that can help them lead a healthy lifestyle and keep them active?
When it comes to that, and I understand because women tend to also suffer burnout quite a bit because of all the responsibilities that they inherently take upon themselves. If you have only 5-10 minutes, then I would say keep the body related fitness to one side, because in 5 minutes, you won't be able to do much for the body, but you can do a lot for the mind. So if you have only 5-10 minutes and you really want to strengthen and build your resilience towards stress, you must include pranayama and meditation. The return you will get on the time invested in doing 5 minutes of diaphragmatic breathing, 5 minutes of alternate nostril breathing, or just 3 minutes of mindfulness breathing or meditation is really powerful. It fundamentally changes the structure of our brain. So then I would move to that, because physical fitness during the day, you can have a step counter, try to get up and take a 5-minute round, 5-minute round. Mothers tend to be active anyway, so because they are running after little kids as well. So you will have to separate the two and focus more on pranayama and meditation. Otherwise, sun salutations. Do 7 rounds whenever you get the time. It's really good for the body anyway.
No, I think it makes a lot of sense because, when they're going through so much that they're doing, they get stressed. And I think the stress leads to not doing what they really need to do. So I think managing the mind is maybe a better thing to do.
The root cause.
Absolutely. But one thing that comes to my mind, Namita, in fact, this is a thought just come into my mind, is that typically when somebody is diagnosed with diabetes, right, the first thing that as an effect of diabetes is that they feel lethargic, right? And that actually leads to procrastination and not doing the exercise or not taking up the yoga regime. What is it that you recommend? Because I'm sure you must be getting people who are coming to your students. And they must be going through that. And typically, the first 7 days are tough because your body is reacting to the sudden exercise, etc. What do you recommend so that they can keep themselves on the journey?
Very nice. So it depends on there are different personality types that get Ayurveda, that get diabetes. So different interventions would work for them. But typically, if lethargy is coming into the picture, you need that initial push to help you break that inertia. And that will come through either becoming accountable through a friend or joining classes or having a teacher or getting a one-on-one class for you, because then you will have to get up. Good thing is you need to do that for, let's say, just a month. Just a month, if you can do private classes or join group classes and get yourself out of that slump, you will maintain that momentum. With yoga, nobody gives up yoga once they start because the benefits are so addictive, you will continue doing. So you have to find that 1 month. Don't think of it as something you have to do for the rest of your life. For 1 month, you need that push, and then it becomes a lot easier. And that's what I would recommend.
Right. And Namita, you mentioned breathing exercises. And can you explain the benefits of breathing exercises? And also, can you explain how the breathing exercise needs to be done?
Yes. So fundamentally, the number one benefit is correction of your breathing pattern. A lot of us suffer from incorrect breathing pattern, and you need to develop that one muscle of breathing, which is most important, which is diaphragm. And pranayama practice, that's why it begins with diaphragmatic breathing, or what we call sectional breathing, particularly for those who have diabetes. And there are a lot of studies as well that people, when they have diabetes or heart issue, they tend to breathe differently as well. They tend to take more shallow, rapid breaths. So correcting the breathing pattern has a lot of influence anyways on the endocrine and hormonal system as well, which we have seen. And that is why when people start doing pranayama, there is a marked decrease in their blood sugar levels, within 20-30 days of practice as well. So if you want to start breathing, diaphragmatic breathing is fundamental. It's best done in a lying down position with the knees bent. But anyway, the concept is simple. There is a muscle called there's a diaphragm which is right here. When you inhale, it presses down. When you exhale, it recoils back. So when it's going to press down, it's going to push everything out. So the belly expands. And that's what we are intending to do. Lie down on the ground, hands on the belly, inhale, feel the belly expand, exhale, feel it go back in. Also exhale fully. A lot of our diseases are a problem of not fully exhaling. So really pulling the navel in to let out the excess breath is a part of the practice. 10 minutes every day is a must for at least 15 days. And the body will reset the breathing patterns. Then you can move on to Nadi Shuddhi or all the other practices.
Got it. So Namita, experts say that your sugar levels shoot up when you are stressed.
Yes.
Right. And so I've heard a lot of doctors tell their patients that, stress mat liya karo. But the patient says that, can you tell me how not to be stressed or how to? So I don't know if you have an answer how not to be stressed, but is there a way to de-stress in yoga?
Yes. Again, I go back to with diabetes, there are 3 interventions, right? There is your diet, there is your exercise, and there is stress management. And yoga is the most powerful stress management practice. Stress will be there, but how do we manage it? We have asana, which stretch and release tension from the body. We have the breath, which then helps you calm down your nervous system. And then you have meditation, which helps you focus that energy for a particular purpose towards a particular objective. This whole practice, this holistic, asana, pranayama, meditation practice builds a resilience towards stress. People start becoming more rational in their thinking. They become less reactive. Multiple research has already shown that meditation helps you calm down, not like 100% calm down, but if something was triggering you very quickly, you will be able to have 2 to 3 thoughts before you react to it. And over years of practice, those 2-3 movements become 10-20 and you become less reactive, which means we are damaging the body less because stress only damages us. It really doesn't bother the person who's stressing us in the first place. So that is one, and I will go back to philosophy because having a life philosophy is really important, whether it is Yoga Sutras or Bhagavad Gita or Stoicism, something that helps you get through life on an everyday basis, which you can read in the morning. Any good philosophy book really helps in generally having a stress management routine.
Got it. So Namita, my last question to you is that while we understand that exercise is important, yoga is good for your body if you are diabetic, but are there some precautions that the diabetics need to take care of while they are doing yoga or following a fitness regime?
Yes, I think the number one that would be inversions, because diabetics also tend to have neuropathy and particularly the eyes, glaucoma. There are some issues which high blood pressure can create. So inversions, which is headstand or shoulder stand or plow pose, they should avoid. And secondly, always listen to the body. We have a habit of really pushing the body too much. And then we stop listening to it and we get injured and we get side effects. Body is very, very intelligent. Do the practice in a mindful way. Don't be aggressive. Don't be in a rush to achieve postures, and that's going to help you. Inversions, be careful with them and listen to the body are the 2 messages.
Awesome. Namita, thank you so much for taking our time. It's been always a pleasure speaking with you.
Same
and your commitment to share this message with the people. We really appreciate that. Thank you so much for taking our time for BW Health.
Thank you a lot, Harvinder. It was really nice to be here, and thanks for the opportunity to promote wellness and yoga. Really appreciate it.
I believe we've had a highly insightful day, which has made us all think why it is important to keep our blood sugar levels in check. As the menace of diabetes rises in India, our measures both at individual and at institutional level have to rise to counter the surmounting burden of the disease. Now, I would like to take this opportunity to thank all the specialized doctors and health experts who have made this day special by enlightening us with their knowledge. I would also like to thank our viewers for joining us here for this highly rewarding conclave, and our BW team for organizing this virtual forum, which I'm sure has given something to everyone as a takeaway.